Hello aspirants, so let me just check, we can start the session now. Let me just check, am I audible, is the screen clear, so that we can start the session now. So this is the session of anatomy MCQ quiz targeting for the FMGE examination June session 2022. So yes, my dear aspirants, am I audible, is the screen clear, so that we can start the session. Okay, so everything is okay, we can start the session now. So yes, my dear aspirants, so today I have targeted in the second part of the FMGE June session MCQ quiz session, which is consists of 50 MCQs today. Okay, so we are going to solve together the 50 MCQs. So stay connected, those who have joined, and let's start the session. So meanwhile, the aspirants will join, and I would like to give you a quick introduction about myself and about the platform of Unacademy. Myself, Dr. Monalisa, and I have done my MD Anatomy from Armed Force Medical College, Pune. I am here to discuss the anatomy MCQs targeting for the FMGE June session 2022. So let's talk about the special class features. The special sessions on the Unacademy platform is a highly beneficial because here you can take part in the poll, you can raise your hands and get your doubts clear right itself when the session is going on. Never ever miss a session. Lecture notes. So once the session is finished, PDF notes can be downloaded, and that is also highly beneficial because you can revise anything if you have missed out. Anytime, anywhere, read from the top educators of Unacademy platform. I would also like to give you information about the special sessions. So high yield anatomy MCQ session targeted for the NEET PG 2022 examination. I am taking this session on 30th January, that is tomorrow, 1 p.m. and 2 p.m. So I am targeted 2 sessions in this, just of 45 minutes and 45 minutes each. So please do join this session targeting NEET PG examination, and this session will be taken tomorrow 1 p.m. 2 p.m. The aspirants who are joining the platform for the first time, what they can do, they can download the Unacademy app, they can find their goal as NEET PG, and thereafter they can use my code ANAT10 and be present as unlocking, they can unlock the session and be present live for the session. Okay, my dear aspirants, I would also like to share the free test calendar for NEET PG examination, and these tests are highly beneficial because they are made by the top educators of Unacademy platform. So these are free tests, so do join. And 30th January, that is tomorrow, you can be the part of free grand test. That timing is 9 a.m. So 9 a.m. is the timing. Be the part of free grand test targeting for the FMGE 2022 examination. So you can enroll for this test by using the code ANAT10. Let's talk about the special, let's talk about the plus course. When I'm talking about the plus course, you can study from the best educators of Unacademy platform. You can be the part of 19 subjects, in which all 19 subjects will be completed in a very systematic way. You can study from the top educators of Unacademy platform. You can compete in live tests and quizzes. You can study on the device of your choice. You can assess more than 25,000 MCQs. These MCQs are clinical MCQs of all 19 subjects made by the top educators, and you can be the part of these sessions if you are going to take the plus subscription. You can use my code for taking the plus subscription and getting 10% discount. I would also like to tell about Iconic subscription. So when I am talking about Iconic subscription, you can access the best of the two platforms. You can access the Unacademy, you can access the Prep Ladder. That means the merging of Prep Ladder and Unacademy can be accessed by you. You can be the part of clinical integrated essentials of Prep Ladder, video lectures from Dream, QBank 3, active guidance, Dream, the printed notes of Unacademy, rapid revision, treasure, dream notes, all can be accessed by you. You can use this code and get a 10% discount, extra 10% discount. Now, I am very happy to share and congratulate the toppers of FMG session December 2021. I wish them best of luck so that they can target the NEET PG exam in the first attempt with a good rank. I would also like to show you this pricing detail of Plus and Iconic, which will give you an idea which subscription you should take. This will be highly beneficial for you. Okay, my dear aspirants, you can use my code ANAT10 to get an extra discount of 10%. This is to inform you that highly updated QBank is there on the platform of Unacademy, where 25,000 and more of the clinical MCQs based on the latest pattern of exam, having a detailed explanation given to each and every MCQs is there. So you want to grab this all MCQs, you want to solve these all MCQs, so just grab the opportunity of taking the plus subscription and getting the discount of 10% by using the code NAT10. Now, I also want to share the information of two batches currently going on the plus platform. One is the Focus FMG 22 comprehensive batch, and the other is Target NEET PG 22 MCQ batch, which is taken by the top educators of Unacademy platform. So just go take the subscription, use this code and get an extra discount of 10%. So my dear aspirants, let's start with the session of 50 MCQs today. So let's start with the first MCQ. All of the following arteries of the pelvis are branches of internal iliac artery except options are umbilical artery, uterine artery, ovarian artery, vaginal artery. Okay. Yes, my dear aspirants, please mark the correct answer. Your time starts now. All of the following arteries of the pelvis are branches of internal iliac artery except, so this is what you have to make the correct answer. Your time starts now. Which is not a branch of internal iliac artery? Which of the following artery is not a branch of internal iliac artery among the options provided? So please mark the correct answer. Your time starts now. Okay, my dear aspirants, please mark the correct answer. Okay, so let me mark it. The correct answer is ovarian artery. So ovarian artery is the correct answer because ovarian artery is a branch of, it's a direct branch of abdominal aorta. Ovarian artery is direct branch of abdominal aorta. Rest all branches which is mentioned here. Umbilical artery, branch of internal iliac artery. Uterine artery, again the branch of internal iliac artery. Vaginal artery, again the branch of internal iliac artery. Okay, so all these are the branches of internal iliac artery except ovarian artery, which is the direct branch of abdominal aorta. So I would like to share this image with you. Okay, so if you will see this image, what you can appreciate the branches of internal iliac artery. So direct branches of internal iliac arteries are, so let's talk about the branches of internal iliac artery. Okay, so the branches are obliterated umbilical artery, superior vesical artery. Actually, what I am marking is all the anterior branches. Obturator artery, vaginal internal vesical artery, uterine and artery to ductus deferens, middle rectal, internal pudendal and that of inferior gluteal. So these 8 branches which I have mentioned is the branch of anterior division, and here superior gluteal, lateral sacral and iliolumbar. These 3 branches are actually the branches of posterior division of internal iliac artery. These are branches of P for posterior division. So got it? These 3 are the branches of posterior division of internal iliac artery. Rest all are branches of anterior division. So all these branches are of internal iliac artery. Now what was mentioned in the answer was that ovarian artery. So see this diagram. This is an ovarian artery and you can see it is directly the branch of abdominal aorta, as you can see in the diagram. Now please quickly revise all the branches of the abdominal aorta. The branches of abdominal, let's talk about firstly the ventral branches of abdominal aorta. Ventral branches of abdominal aorta is following: celiac trunk is one of the which is given at the level of T12, superior mesenteric artery given at the level of L1 and inferior mesenteric artery given at the level of L3. These 3 are the branches of ventral branch. Other branches are gonadal artery. So that means both testicular artery and that of ovarian artery are gonadal artery, are direct branch of abdominal aorta. Lumbar artery, we have got 4 pairs of lumbar artery. We have got right and left common iliac artery and median sacral artery. Other than that, renal arteries, all these are the branches of abdominal aorta. One of the branches not shown here, that is the inferior phrenic artery. So see here, if I enlarge it, inferior phrenic artery, this is the first branch of abdominal aorta. This was not shown in the previous image, so I have showing you this diagram. This is the first branch of abdominal aorta, inferior phrenic artery. So done with this, now let's move on to the second MCQ, that is, which of the following structure extends into labia majora? Which of the following structure extends into labia majora? Suspensory ligament of ovary, ligament of ovary proper, processus vaginalis, round ligament of uterus. So anyone who wants to give the answer can reply here. Round ligament of uterus is the correct answer. Among the option provided, it is the round ligament of uterus which is extending into the labia majora. So see here. So actually round ligament of uterus arises from the lateral aspect of the uterus body, and then it traverses through, it will pass through deep inguinal ring, and it will traverse through the inguinal canal, will come out through superficial inguinal ring, and it is extending till the level of, so it is extending till the level of labia majora. So it will give fibrous strands into the labia majora. So which is the correct answer? Yes, Khan, you are absolutely correct. Round ligament of uterus is absolutely correct answer. Great, Khan. So let's move on to the next. Let's move on to the third MCQ. Recto-sigmoid junction lies anterior to which of the following bony landmarks? S3 vertebrae, prostate, S3 vertebrae, prostate, obturator, foramen, urinary bladder. According to you, which is the correct answer? Okay. Yes, Khan, that was absolutely right. Now let's mark the other one. Okay. Recto-sigmoid junction lies anterior to which of the following structure or the landmarks? Okay, the correct answer is S3 sacral vertebra. The correct answer is S3 sacral vertebra. Recto-sigmoid junction, the junction of rectum and sigmoid colon. So see here, these are the sacral vertebrae which has been marked. This is the whole sacral curvature, and you can see at the level of S3 sacral vertebra, we have got the corresponding level or the junction of recto-sigmoid junction. Okay, so recto, at the level of recto-sigmoid, so what will be the correct answer? That recto-sigmoid junction is corresponding to the level of third sacral vertebrae. Yes, let's move on to the next. Urogenital diaphragm is contributed by all except. Urogenital diaphragm is contributed by all except. The options are sphincter urethrae, perineal body, Colles fascia. The options are sphincter urethrae, perineal body, Colles fascia, perineal membrane. Okay, so please mark the correct answer. Your time starts now. 4 options are there. 4 options are there, and you've just marked the correct answer. Okay, your time starts now. So the first thing you have to know what is urogenital diaphragm. Okay, which structure is contributing? Actually, urogenital diaphragm is consist of muscles. It is containing 2 important muscles. Okay, urogenital diaphragm, which is covered by superficial and inferior fascia of urogenital diaphragm, and it is consist of 2 muscles. It is consist of urogenital diaphragm is consist of 2 muscle. One is deep transverse perineal muscle, and the other is sphincter urethrae muscle. Now, this is the 2. So here means that sphincter urethrae is consist. So it is there. Perineal body, actually perineal body is fibromuscular zone, actually where the 10 muscles are interlacing. So we have got deep transverse perineal muscle. So actually we have got deep transverse perineal muscle is also interlacing at the perineal body. So this is also the content. Other than that, what do we mean by the perineal membrane? So perineal membrane is actually inferior layer. It is the inferior layer which is covering the urogenital diaphragm. So it is also contributed. So we have got the correct answer as Colles fascia. So we have to choose the correct answer which is not contributing, and formation of urogenital diaphragm is the Colles fascia. Actually, Colles fascia is related to formation of superficial perineal pouch. Okay, my dear aspirants, I would like to show you this diagram. So this is a diagram where you are seeing the urogenital diaphragm. So see here. Exactly, this is the urogenital diaphragm, and what I told you, urogenital diaphragm is having superficial fascia and inferior fascia. Okay, it is having a covering which is called as superficial fascia of urogenital diaphragm and inferior fascia of urogenital diaphragm. Now, in between superficial fascia of urogenital diaphragm and inferior fascia of urogenital diaphragm, which is also called as perineal membrane, there is location of deep perineal pouch. Okay, there is location of deep perineal pouch. Now, just below it, we have got another space which is called a superficial perineal pouch, and it is underlined by another membrane that is called as Colles fascia. Actually, the membranous layer of superficial fascia, we know that superficial fascia of the abdomen is containing fatty layer and membranous layer. Fatty layer is campus और membranous layer को क्या बोलते हैं? Scarpa fascia. So the continuation of scarpa fascia lower down in case of perineal region forms Colles fascia. So Colles fascia is related to superficial perineal pouch, and it has got no correlation with the deep perineal pouch or urogenital diaphragm. So yes, Khan has given C as the answer. Absolutely correct, Khan. So here we have got the correct answer. Other than that, I would also like to show you the perineal body. Let me slightly enlarge this diagram. So yes, if I am enlarging this diagram, okay, you can clearly see the perineal body and you can appreciate it. So what you can appreciate that this structure, let me mark a fibromuscular node here, this nodular structure where interlacing of the muscles are taking place. This zone is called as perineal body. This is called as perineal body. Now, this is called as perineal body. Okay, now, so here we have got the muscles which is interlacing at this level. So we have got the two bulbospongiosus muscle interlacing. We have got the two bulbospongiosus muscle. We have got superficial transverse perineal muscle, two on either side. Deep to it lies the deep transverse perineal muscle. Deep transverse perineal muscle. That is also 2. So 6 muscle. Levator ani muscle of both the side. 2. External anal sphincter muscle. Okay, external anal sphincter muscle of 1, and longitudinal muscle coat of rectum and anal canal. Rectum and that of anal canal. So this is also 1. So together if we calculate this together becomes 10 muscles. So 10 muscles are interlacing here. So deep transverse perineal muscle is also related in the level of perineal body. So we have got the correct answer and explanation. Let's move on to the next MCQ, that is MCQ number 5th. Yeah. So ovarian fossa, the MCQ is targeting. Ovarian fossa is formed by all except. Ovarian fossa is formed by all except. The options are obliterated umbilical artery, internal iliac artery, ureter, round ligament of ovary. So according to you, which of the following structure is not contributing to form the boundary of ovarian fossa? To form the boundary of ovarian fossa. Your time starts now. Mark the correct answer. Question number 5th. Ovarian fossa is formed by. So my dear aspirants, which of the following structure is not contributing to form any kind of boundary for ovarian fossa? Here the correct answer is round ligament of ovary. Round ligament of ovary. Rest all structures which is mentioned in the option is forming the boundary of ovarian fossa. Okay, so let us solve this. So see here. Ovarian fossa, if we talk about ovarian fossa, it is a depression which is lying in the lateral pelvic wall. It's a shallow depressed area lying in the lateral pelvic wall where the ovary is located. Okay, so if we talk about ovarian fossa boundaries, it is superiorly bounded by external iliac artery and vein, anteriorly and inferiorly by the broad ligament of uterus, posteriorly by ureter, internal iliac artery and vein, inferiorly by obturator nerve, artery and vein. So please by heart the boundaries of ovarian fossa. superiorly external iliac artery and vein, anteriorly and inferiorly round ligament of uterus, posteriorly by ureter and internal iliac artery and vein, inferiorly by obturator nerves and vessels. Obturator nerves and vessels. So all of you do revise the boundaries of ovarian fossa, which is shown here. Okay. Yes, got it everyone. Now, one of the option was obliterated umbilical artery. So I just want to tell that obliterated umbilical artery is crossing the ovarian fossa anteriorly. So as we know, it is a depression in the lateral pelvic wall, parietal peritoneum, and it is bounded in front or anteriorly. You can say both words are similar. Obliterated umbilical artery. So yes, and we already know ureter, uterine vessels all are lying in relation. So I will show you this diagram and help you to understand the boundaries of ovarian fossa. Okay, so yes, let me just enlarge this diagram. See here. So this structure is the ovary. Okay, so if you will see, okay, so just concentrate on this. This structure is the ovary. Okay, this is the ovary. So it is having posterior relation of ureter. So posteriorly it is related to the structure, that is ureter, as you can see here posteriorly, and these are the vessels. So these vessels are internal. These vessels are internal iliac artery and vein. Internal iliac artery and vein will be in relation posteriorly. Inferiorly will be obturator nerves and vessels. So obturator nerves and vessels will be related inferiorly. Okay, superiorly external iliac vessels. External iliac vessels. See here, the important boundaries of ovarian fossa has been shown to you. Important boundaries. External iliac vessels superiorly and crossing anteriorly. Internal iliac artery and vein, and ureter is lying posteriorly. Obturator nerves and vessels are lying inferiorly. And anteriorly it is crossed by obliterated umbilical arteries. So done with this, let's move on to the next, that is question number 6th. Okay, so my dear aspirants, your question starts. Laterally, peritoneum of broad ligament is prolonged superiorly over ovarian vessels as. Laterally, peritoneum of broad ligament is prolonged superiorly over the ovarian vessels as mesoovarium, mesosalpinx, mesometrium, suspensory ligament of ovary, transverse cervical or cardinal ligament. So according to you, which is the correct answer? That means what is the lateral extension of broad ligament, which is prolonged superiorly over the ovarian vessels? What is the term or the ligament is called? So 5 options are there. Mark the correct answer. Question number 6. Okay, so it's the suspensory ligament of ovary. It's the suspensory ligament of ovary. The correct answer is suspensory ligament of ovary, which is also called as infundibulopelvic ligament. Which is also called as infundibulopelvic ligament. Suspensory ligament of ovary, which is also called as infundibulopelvic ligament. Okay. Okay, so my dear aspirants, so yes, absolutely correct. Okay, so we'll resume soon we'll resume, okay. So yes, we were in the 6th MCQ, that is what is the laterally peritoneum extension of broad ligament over the ovarian vessels called as. Okay, so all of you can resume. Okay. Okay, so suspensory ligament of ovary was the correct answer, suspensory ligament. So let me just give you the explanation, so use the diagram. Laterally, peritoneum of the broad ligament is prolonged over the ovarian vessels, and actually this suspensory ligament of ovary, which is also called as the infundibulopelvic ligament, is extended over the prolonged and containing ovarian vessels. So part of broad ligament by which ovary is suspended. And I would also like to give you the explanation of other parts of broad ligament. So actually suspensory ligament of ovary is also the part of broad ligament. We know that broad ligament is a secondary support of the uterus and it has got various parts. So part of the broad ligament which is suspending ovary is called as mesoovarium. This part is called as mesoovarium. Now, the part of broad ligament forming mesentery of uterine tube is mesosalpinx. What is it? It is called as mesosalpinx. Got it? The majority of the part of broad ligament that is it is also has been asked in the MCQ so many times that which part of the broad ligament is considered to be the mesentery of uterus. The answer is mesentery of uterus. Mesentery of uterus is mesometrium. Mesometrium is considered to be the mesentery of uterus. And let me show you the diagram. The first MCQ which has been asked here was suspensory ligament of ovary, which is a part of broad ligament. And through the suspensory ligament of ovary, which structures passes ovarian vessels, traverses through the hilum of the ovary. This is the broad ligament, and the part of the broad ligament which is containing the ovary, holding the ovary, that is mesoovarium. So this part will be the mesoovarium. And the part of the broad ligament which is winding around the fallopian tube is called as mesosalpinx. So see here, this is mesosalpinx, which is the part of broad ligament, which is the area of the broad ligament which is lying between the uterine tube and that of the ligament of ovary. So here we can see the mesosalpinx, this whole area which you are seeing, which is extending laterally. And this is the mesometrium, that is mesentery of broad ligament, and this is mesoovarium, which is exactly attached to the posteriorly aspect of ovary containing the ovary. This is called as mesoovarium. So we can see mesoovarium, we can see mesometrium, and the part of ovary which is connecting between which is the part of broad ligament between the uterine tube and ovary is mesosalpinx. And this part which has not been labeled here, this part is the S for suspensory ligament of ovary. So is it clear? Let me know. Is it clear? Okay, let's move on to the next, that is question number 7. Okay, question number 7th. Got it? All nerves provide innervation to scrotum except. All of the following nerves provide innervation to scrotum except. Okay. All of the nerves provide innervation to the scrotum except. Options are obturator nerve, ilioinguinal, genitofemoral, pudendal, posterior femoral cutaneous nerve. Okay. So according to you, which is the correct answer? All nerves provide innervation to the scrotum except. We have got obturator nerve, we have got inguinal nerve, we have got genitofemoral, pudendal and posterior femoral cutaneous nerve. Yes, my dear aspirants, so which is the correct answer? Your time starts now. Okay. So the correct answer here is obturator nerve. The correct answer is obturator nerve. Actually, rest all the nerves which is mentioned here is giving innervation to the scrotum except the obturator nerve. And let me show you a diagram for it. If we talk about the scrotum innervation, it's anterior part of the scrotum and posterior part of the scrotum. So innervation can be studied as innervation of anterior part of the scrotum and innervation of posterior part of the scrotum. When we are talking about the nerves which is giving or innervating the scrotum anterior part, the nerves are, following nerves are there: anterior scrotal nerves, which is derived from ilioinguinal and genital branch of genitofemoral nerve. Same way, when we are talking about the posterior aspect of the scrotum, it is getting innervation from posterior scrotal nerves, which provide perennial branches, pudendal and perennial branches also from the branches of pudendal nerve, and also perennial branches from posterior femoral cutaneous nerve. So clearly we can see here there is no involvement of obturator nerve. So this diagram is again showing you the innervation of the scrotum, ilioinguinal nerve, genitofemoral nerve, posterior scrotal branch of perineal nerve and perineal branch of posterior cutaneous nerve. So yes, we can see that there is no involvement of obturator nerve. So we will mark obturator nerve as the correct answer. Let's move on to the next, that is question number 8. All arteries enters true pelvis except all of the following arteries which is mentioned here: internal iliac, median sacral, superior rectal, ovarian and testicular arteries. So all these arteries are entering into the true pelvis except which of the following arteries not entering into the true pelvis. Your time starts now. Mark the correct answer. So yes. So the correct answer here is testicular artery. Testicular artery is the correct answer, which is not going inside the true pelvic region. Rest all arteries are going into the true pelvis. So actually there are 4 main arteries. If we talk about the arteries, so there are 4 main arteries which enters into true pelvis, which is also called as the lesser pelvis. These arteries are internal iliac artery, ovarian arteries. These are internal iliac artery, ovarian arteries, median sacral, superior rectal arteries. Okay. So mark it. We have got internal iliac artery, we have got ovarian arteries, okay, median sacral arteries and superior rectal arteries. So these are the arteries of true pelvis. Other than that, if testicular arteries, as we have marked, it's not entering into the true pelvis. Actually the whole course of the testicular arteries is that it follows the testes through the inguinal canal and reaches the scrotum. So it is reaching the testes through passing through the inguinal canal. So it is not going inside the true pelvic region. So yes, we have got E as the correct answer for question number 8. Let's move on to the next, that is question number 9. Let's move on to question number 9. All statement considering uterus is correct except, so following options are there. All statement about uterus is correct except it is anteverted, anti-flexed. It is anteverted, anti-flexed, position of uterus is fixed, it is divided into 2 main parts and the body of uterus lies between the layers of broad ligament. So I got an answer from Devesh. Devesh has given C, position of uterus is fixed. Okay, Devesh, you are absolutely correct. Yes, this is the wrong statement about uterus, that always the position of uterus is fixed. It is not the case. The position of uterus is or not always fixed. It also depends on the surrounding and neighboring structures, whether the urinary bladder is full or empty. These are the where the uterus position can be changed. It's not always fixed. Other than that, all other option which is mentioned here is perfectly correct. Yes, we also know that normal position of uterus is anteverted and anti-everted, and it is having cervix and the body 2 parts. So this is also correct, and it lies, the body of the uterus, if you will see, it is residing between the 2 layers of broad ligament. So all other points are perfectly correct except the C point, that is position of uterus is fixed. So yes, absolutely correct, Devesh. Uterus is thick-walled, pear-shaped muscular organ, and the body of uterus is traversing between the 2 layers of broad ligament. So absolutely correct. This point is absolutely correct. Now my dear aspirants, the uterus in case of adults, normal position is, as I told you, it is anteverted and anti-flexed. Anti-flexed and anteverted position. Anteverted 90 degree anteverted, anti-flexed 130, 40 to 170 degrees anti-flexed. That is the angulation, forward angulation between the long axis of the uterus. Okay, and the cervix and vagina angle anteriorly is anteverted. So yes, we are not going into details of that description, and also as I told you, with the fullness of bladder and rectum, the position of the uterus varies. So let's talk about question number 10th. Direct MCQ. Subcostal nerve is dorsal ramus of T6, ventral ramus of T6, dorsal ramus of T12 or ventral ramus of T12. According to you, which is the correct answer? Subcostal nerve is. So your time starts now. Subcostal nerve is. Please mark the correct answer. I will wait 30 seconds for you. Subcostal nerve is A, B, C, D. Which is the correct one? So Khan, Devesh. Okay, so actually subcostal nerve is formed by T12 nerves and it is formed by the ventral ramus of T12. So we will go with D as the correct. Subcostal nerve is formed by anterior rami. It is formed by anterior rami or ventral rami of T12 nerves. T12 nerves. Got it? So we have got D as the correct answer. Yes, let's move on to the next. Left superior intercostal vein drains into. Left superior intercostal veins drains into. Which is the correct one? Whether it is draining into a gyrus vein, whether it is draining into hemiazygous vein, brachiocephalic vein, internal thoracic vein. According to you, which is the correct answer? Left superior intercostal vein drains into which of the following? Okay, I got an answer from Bablu Kumar. It's C. Okay, so left superior intercostal vein drains into brachiocephalic vein. Absolutely correct, Bablu Kumar. Absolutely correct, Mr. Bablu. So yes, brachiocephalic vein is absolutely correct. Actually, the drainage of, so first thing is that, can anybody tell me superior intercostal vein? So how is the superior intercostal vein formed? The first thing is superior intercostal vein in both right hand side and left hand side is formed by joining second, third and fourth, is formed by joining second, third and fourth posterior intercostal vein. So posterior intercostal vein will join together to form superior intercostal vein. In right, if we talk about the drainage, right superior intercostal vein drains into a gyrus vein. But if I talk about the left hand side, left superior intercostal vein drains into brachiocephalic vein, brachiocephalic vein. So in the MCQ it has been asked about left hand side, so we will go with C as the correct answer. Actually the drainage of posterior intercostal vein is different on right hand and left hand side. So see this diagram. When we are talking about the drainage of posterior intercostal vein about right and the left hand side, it is different. So see here. Okay, so let's see this diagram, veins of the thorax wall, and here what I want you to show, let me just highlight this diagram, enlarge this diagram so that you can better understand. So here the posterior intercostal vein, these are all what? These are posterior intercostal vein. Okay, now what you can see, the first one, the first is draining into right brachiocephalic vein in the right hand side, and the first, this is the first is draining into brachiocephalic vein. Now second, now see here, second, third and fourth will join to form superior intercostal vein. Okay, so in the right hand side, as you can see, it is draining into this azygous vein. In right hand side it is draining into azygous vein, but in the left hand side you can see here, this is left superior intercostal vein, which is formed by again joining, which is again formed by joining second, third and fourth left posterior intercostal vein, and you can see here it is joining into brachiocephalic vein. Is it clear? It is joining and draining into brachiocephalic vein in the left hand side. Is it clear? Okay, now 5th, 6th, 7th, 8th, 9th, 10th, 11th posterior intercostal vein all drains into A for azygous. All are draining into A for azygous, but 5th, 6th, 7th, 8th is draining into accessory hemiazygous, and 9th, 10th and 11th posterior intercostal vein is draining into, so in hemiazygous 9th, 10th and 11th left posterior intercostal vein drains, and 5th, 6th, 7th and 8th left posterior intercostal vein drains into accessory hemiazygous, will drain into accessory hemiazygous. So accessory hemiazygous left side में different है, 5th, 6th, 7th, 8th, 9th, 10th and 11th in hemiazygous in the left hand side. So have you understood? Let's move on to the next. So we have done with this. Let's move on to the next MCQ, that is MCQ number 12th. Okay, the structure passing posterior to the diaphragm are all except aorta, azygous vein, thoracic duct, greater splanchnic nerve. Structures passing posterior to the diaphragm are all except. We have got 4 options: aorta, azygous vein, thoracic duct, greater splanchnic nerve. Okay. So yes, please mark the correct answer. Your time starts now. Question number 12. So I will give 30 seconds to everyone. Please mark the correct answer. Khan, Devesh. Okay, I got an answer from okay, Devesh. Devesh, you are absolutely right. Greater splanchnic nerve. Yes, greater splanchnic nerves, lesser splanchnic nerve, least splanchnic nerves, they are piercing the respective crura of diaphragm on right and the left hand side. And aorta, azygous vein, thoracic duct, they all passes through aortic opening of the diaphragm, and we know that aortic opening of diaphragm is lying posterior to the diaphragm. So we have got D as the correct answer. Absolutely correct, Devesh. Absolutely correct, dear. Absolutely correct. Yes. Now see here. If you will see this diagram, you can appreciate the minor and major openings of the diaphragm. So please let me slightly enlarge this image. So if I am enlarging this image, you can clearly see the major and the minor opening. So one of the opening which lies anteriorly here, this gap, actually this is called as foramen of Morgagni, and this is lying on the right, most commonly an anterior right hand side, and and it is a gap which is seen between, actually it is a gap which is seen between the xiphoid origin of the, say, xiphoid origin. We know that from the sternum posterior aspect xiphoid process, the muscular slip of diaphragm opens. So in that there is lying an opening in between the costal slip and xiphoid process opening, and that opening is most commonly lying on the right hand side, sometimes can be on left hand side. That is called as space of Morgagni and Larrey. Structures passing through it is, the structures traversing through it is superior epigastric artery, and we know that superior epigastric artery is a branch of internal thoracic artery. Now let's talk about the vena cava opening. So let's talk about this vena cava opening. We know that vena cava opening is exactly lying at the level of T8, and the structures traversing through it is inferior vena cava and right phrenic nerve. Inferior vena cava and right phrenic nerve. So structures traversing is inferior vena cava and right phrenic nerve. Inferior vena cava, right phrenic nerve. Now let's talk about esophageal hiatus. So we know that esophageal hiatus again is lying at the level of T10, and the structures traversing is mainly esophagus and right and the left vagus, which is anterior and posterior vagal trunks. So this is exactly the esophageal opening at the T10 level, and the structure is esophagus, anterior posterior vagal trunk, esophageal branch of left gastric artery. These are the major structures. Now if I talk about the aortic hiatus, so if I talk about the aortic hiatus, that is at the level of T12, aorta, thoracic duct, azygous and hemizygous veins, thoracic duct, all these structures traverses through it, and it is lying at the level of T12. It is lying at the level of T12. It is lying at the level of T12. Got it? And what about the minor opening? So let's talk about the minor opening. So the minor apertures and are there in the crudas of the diaphragm through which greater, lesser and splanchnic nerves are passing. Inferior vena cava, say inferior vena cava and right phrenic nerve passes. It is lying at the level of T8. So quickly we have revised. Actually for your competitive exam of FMGE session 2022 June, it is important that you should revise all the openings of the diaphragm. Has been asked so many times in the previous year. Let's move on to the next. Now, let's move on to question number 13. Which of the following is most superior structure at the hilum in the left lung? Which of the following structure is most superior structure at the hilum in the left lung? Whether it is pulmonary vein, pulmonary artery, bronchus or bronchial artery. So yes, we have got 4 options. Please mark the correct answer. 8, 10 at 12 o'clock. Okay. A good mnemonic is given by Devesh. Great. Okay. So yes, I am waiting for your answer. Okay, so let's mark it. Okay, so yes, Davis has given the D as the right answer. Let me tell you which is the right structure. So when we are talking, it is important that we should know the structures. We should we can also, like when we are talking about the structures which is lying in the superior most aspect of the left lung, it's the pulmonary artery. Okay, my dear aspirants, when we are talking about the structures lying in the hilum of the lung, we have got structures relating the hilum of the lung. From above to downward, the relation is different on right and the left hand side, but from before to backward, the relation is similar. So it is important that I should show you a schematic diagram explaining you the relation of hilar structures as we move from above to down. So let's start with this. So my dear aspirants, see here, let's we talk about so here you can write the heading, structures related in the hilum of lung from above to down, okay. So see here, so let's talk about the relation. So structures related in the hilum of the lung from above to down. So one side we have got right lung and the other side we have got left lung. Okay, so let's see the relations. Now, my dear aspirants, the superior most structure in the right lung will be, okay, the superior most structures for the right lung will be hip arterial bronchus. So this is the superior most structure. Then we have got the pulmonary artery, the second structure. Then we have got the hyparterial bronchus, and the inferior most structure is the pulmonary vein. So got it? So that means from superior to inferior, we have got following structures related. We have got hip arterial bronchus as the superior most structure, then we have got pulmonary artery, then we have got hyparterial bronchus, and the inferior most structure in the right hand side is inferior pulmonary vein. So is it clear? Now let's see the relations on the left hand side. So here the superior most structure is the pulmonary artery, because there is this difference is because we have got just one bronchus in the left hand side. Okay, pulmonary artery, and we have got this bronchus. This is actually principal bronchus. This is actually principal bronchus. Okay, so this is exactly the principal bronchus, which is the second most structure from the superior aspect, and inferior most structure is inferior pulmonary vein. This is the third most structure. This is the third structure. So the relation is exactly different. So is it okay? Have you understood, Devesh and everyone? So this is the relation. So there is variation in relation of the structures in the hilum of right and the left hand side, because the bronchus is only one principal bronchus in left hand side, but in the right hand side we have got two bronchus. When the principal bronchus of right hand side is entering into the right hilum, it divides into eparterial bronchus and hyparterial bronchus. So this, because of this, the difference lies here. Got it, everyone? Got it, everyone? So let's move on to the next. So I'm not, is it okay? Have you understood? Let's directly move on the next MCQ. All of the following arteries are common site of occlusion by thrombus except. All of the following arteries are common site of occlusion by thrombus except. Options are anterior interventricular artery, posterior interventricular artery, circumflex artery, and marginal artery. All of the following arteries are common site of occlusion by thrombus formation except. So your time starts now. Please mark the correct answer. So actually the formation of thrombus will lead to myocardial infarctions and heart attacks. So which arteries are commonly involved? The MCQ is targeting about which arteries are commonly involved. So waiting for your, okay, I got an answer from Devesh. Okay. So it is for question number 14. Please, Devesh, can you write that number also, because it will become confusing, because today we have got 50 MCQs to solve. Is it okay? I think, no, I think this is not the answer of 14. So yes, okay, no worries, I will give you the answer. The least commonly affected by occlusion formation is the marginal artery. Okay, so actually it is very important and has been asked in the previous year that which are the most common arteries to be involved in the formation of thrombus. So for that I would like to give the correct answer. My dear aspirants, if we have to mark the correct answer, the most common artery to be involved is, so thrombus formation commonly involves following artery, commonly involves following arteries. Okay, so my dear aspirants, let me see, the most commonly artery involved is LAD artery. Okay, the most common arteries involved is the LAD artery. So in most of the cases LAD arteries are involved, in 50 to 60% cases LAD arteries are involved. And my dear aspirants, we know that LAD का full form क्या है? Left anterior descending artery, which is a branch of left coronary artery, and it is also called as anterior interventricular artery. It is also called as anterior interventricular artery. Okay, my dear aspirants, so this is the first most commonly involved. Then we will move on to the second most commonly involved. The second most commonly involved artery is right coronary artery. So exactly in 50% cases LAD arteries are involved. In 30% of cases the right coronary artery directly is involved, and third commonly involved artery is left circumflex artery. Actually left circumflex artery is again the branch of left coronary artery, and it is involved in 15% of the cases, and rest any of the arteries can be involved. So that means the least commonly involved artery will be the marginal artery. So we will have got D as the correct answer, that is marginal arteries. Is it okay? Okay. So now my dear aspirants, let me just show you this diagram showing the blood supply of the, or showing the arterial supply of the heart. So in this case what you can see, the right coronary artery is traversing one of its most important branches, posterior descending. Actually posterior descending artery is also called as posterior interventricular artery, and we know that posterior interventricular artery is artery of dominance. Posterior interventricular artery is designated to be the artery of dominance. It is called as artery of dominance, and it's a branch from right coronary artery. In 90% cases it is a branch from right coronary artery, and it is also giving other branches of right coronary artery is marginal artery. Left coronary artery, most important branches are left circumflex and LAD artery, and also diagonal artery, and it is also giving marginal artery. So here the most commonly involved artery for the thrombus formation is LAD artery, or left anterior descending or anterior interventricular artery. Got it everyone? Let's move on to the next, that is question number 15. All of the following are, so one more point I just want to write here. Okay, now you're okay. See here, all of the following are, so let's start reading this. All of the following are characteristic features of bronchopulmonary segment of the lung, except option A, it is surgically resectable. It is named according to the segmental bronchus supplying it, and it is drained by independent intrasegmental branch of pulmonary vein, and it is the largest subdivision of a lobe. So what is the correct answer? 15th number. Question number 15, please mark the correct answer. So you have to tell me which is the incorrect statement about bronchopulmonary segment. Incorrect statement about bronchopulmonary segment. So we have got 4 options. So here my dear aspirants, we have got C as the incorrect answer. So why C is the incorrect answer? Okay, C is the incorrect answer. So we know that if we have to define bronchopulmonary segment, we clearly know that bronchopulmonary segment is the structural and functional unit of the lung, and we have got 10 bronchopulmonary segment in the right hand side and that of the left hand side. We have got 10 bronchopulmonary segment in the right hand side and the left hand side of the lung. It is surgically resectable, and we have got individual bronchus segmental branch residing inside one bronchopulmonary segment is the largest subdivision. Actually, the location of pulmonary vein tributaries is intersegmental. It is lying in between the bronchopulmonary segment, not intrasegmental. So we have got C as the incorrect option. Okay, let me show you a diagram which will help you to understand the proper definition of bronchopulmonary segment. Okay, so bronchopulmonary segment, how many bronchopulmonary segment on right hand and left hand side? We have got 10 bronchopulmonary segment right side ke liye or left hand side ke liye. Now, see here this is the one, so see here, this is if I enlarge it, this is one bronchopulmonary segment. This is another bronchopulmonary segment. Now, according to the definition, you can see here, if we want to define bronchopulmonary segment, the structures which is residing inside the bronchus will be the segmental branch of the bronchus, there will be a segmental branch of bronchial artery, there will be a segmental branch of bronchial pulmonary artery. So these three structures means segmental branch of bronchus, segmental branch of pulmonary artery, segmental branch of bronchial arteries are lying inside the bronchus, inside the bronchopulmonary segment, means this. Okay, this is one bronchopulmonary segment. Okay, and this one is the other bronchopulmonary segment. So exactly these are residing inside one bronchopulmonary segment. See here, got it? Here we have got tertiary bronchus. Okay, on both the side we have got also the bronchial arteries, we have got also the pulmonary arteries. Now let's see the location of pulmonary veins tributaries. Now see here, here you can see a tributary of pulmonary vein. So here exactly the tributary of pulmonary vein is located, here exactly the tributary of pulmonary vein is located, here also tributary of pulmonary vein is located. So this is these tributes, so this is exactly, so that means these are tributaries of pulmonary vein, and clearly we can see the pulmonary vein tributary is intersegmental. It is intersegmental, my dear aspirants. It is not inside, it is intersegmental. It is not inside the bronchopulmonary segment, it is lying in between the bronchopulmonary segment. So I think this is clear to you, everyone. Question number 15 is clear to you? Okay, so let's proceed with question number 16. Which of the following structure is located in posterior mediastinum? Okay, which of the following structure is located in posterior mediastinum? Options are lung, heart, azygous vein, superior vena cava, right coronary artery. 5 options are there. Okay. So please mark the correct answer. We have got 5 options here. Which of the following is the structures located in the posterior mediastinum? Actually, in the previous year MCQs which I have seen of the FMG examination, their favorite question is that they always ask about the contents of the mediastinum. So it is important that you should also revise the contents of mediastinum. Okay. So yes, 30 seconds please. So you can mark the correct answer. Which is the correct answer, dear? Okay. The correct answer is azygous vein. In this option only azygous vein is the structure which is residing in the posterior mediastinum. Okay, this is residing in the posterior mediastinum. Actually, heart and its great vessels are lying in the middle mediastinum. Anterior mediastinum, we have got the structures connecting the sternum and that the pericardium, and we have got the branches of internal thoracic artery also. So here azygous vein along with other veins, which is the content of posterior mediastinum, actually thoracic duct. Posterior mediastinum contains thoracic duct, thoracic aorta part, azygous, hemiazygous vein, esophagus and thoracic sympathetic trunk. So all of you please note down all the contents of posterior mediastinum. Contents of posterior mediastinum, very important. Contents of posterior mediastinum is an important things which you should revise. It contains thoracic duct, thoracic aorta, azygous vein, hemiazygous vein, esophagus and thoracic sympathetic trunk. Got it, everyone? So yes, let's move on to the next. Which is not a content of anterior mediastinum. So here options are given. So this is another MCQ which is targeting the contents of anterior mediastinum. So which of the following is not a content of anterior mediastinum? Fat. Okay, it's a content, but so fat is means it's not a definitive content. Fat is located in many places. Sternopericardial ligament, branches of internal thoracic vessels, lymphatic vessels, or that of the heart. So easy one only. Please mark the correct answer. According to you, which is the correct answer? Which is not forming a content for the anterior mediastinum? Which of the following structure is not located in anterior mediastinum? Your time starts now. Please mark the correct answer. So actually all other top, that is fat, lymphatic vessel, branches of internal thoracic vessels, sternopericardial ligament, fat, lymphatic, all these are the content of anterior mediastinum. But heart is not the content. Why? Because heart is the content of middle mediastinum. Heart is the right answer because heart is the content of middle mediastinum. Heart is the content of middle mediastinum. Got it? Okay. So my dear aspirants, please note down, this is important for MCQ, the contents of anterior mediastinum. The contents of anterior mediastinum is, it contains fat, it contains sternopericardial ligament, also the branches of internal thoracic vessels and that of lymphatic vessels. So all these structures are the content of, anterior mediastinum. Okay, so yes, done with this. Okay, contents of mediastinum is an important topic for your FMG entrance examination. So yes, let's move on to the next, that is question number 18. Question number 18. Okay, intercostobrachial nerve communicates with, so intercostobrachial nerve communicates with medial brachial cutaneous nerve, thoracodorsal nerve, long thoracic nerve, first intercostal nerve or sympathetic trunk. Question number 18, we have got 5 options and you have to give me the right answer. Intercostobrachial nerve communicates with. So that is important that you should know what is intercostobrachial nerve firstly, then you have to know its communication. So 5 options are there, mark the correct answer. Okay. So my dear aspirants, intercostobrachial nerve communicates with, actually the correct answer is medial cutaneous nerve of arm. So first thing is that what is intercostobrachial nerve? So intercostobrachial nerve is a branch from, it's a lateral cutaneous branch of second intercostal nerve. So see here, intercostobrachial nerve is lateral cutaneous branch of second intercostal nerve. It's a branch from second intercostal nerve, and it is giving supplying sensation to the skin in the axilla. Actually, whenever dissection is done, at times when you will proceed for the dissection of the axillary region, you can appreciate this communication, where you can appreciate the communication lies between the intercostobrachial nerve and that of medial cutaneous nerve of arm. I will show you that one of a dissected image also. It actually, when we are talking about intercostobrachial nerve, it is leaving the second intercostal space, an exact location. It leaves at the mid axillary line, and subsequently it is piercing serratus anterior muscle to merge with the subcutaneous fat residing in the axillary region. So it get merged with the subcutaneous fat. So if you go with a very accurate dissection, and if you want to appreciate, there you can appreciate the communication of second intercostal space cutaneous nerve communicating with medial cutaneous nerve of arm. So let me show you that. Intercostobrachial nerve communicates with medial cutaneous nerve brachial, that is medial cutaneous nerve of arm. Now, next important point is show you a diagram where you can appreciate this communication, and you can appreciate this relation. So, let me slightly enlarge this image. This is a cadaveric image in which a beautiful dissection of the axillary region has been done. Okay. So, here so here MCN, what is this? This is medial cutaneous nerve. This is medial cutaneous nerve of arm. And what is this nerve? This is the second intercostobrachial. Actually, this is the intercostobrachial nerve from lateral cutaneous branch from the second intercostal nerve. And here the communication. So let me use a yellow color showing this nerve and communication, this one. So these are cords of brachial plexus which has been shown, but here what you have to appreciate here, the communication between the medial cutaneous nerve and that of intercostobrachial nerve, which is quite appreciable in this diagram. This is quite appreciable in this diagram. So is it okay? So we will move on with the correct answer, and here the correct answer is A. Question number 18, we have got medial cutaneous nerve of arm as the correct answer. Okay, let's move on to the next, that is question number 19. Muscle inserting onto the medial aspect of scapula. Options are subscapularis, serratus anterior, teres minor, latissimus dorsi. Okay, aspirants, those who are listening, please let me know, are you understanding? Any doubt? Please be free to ask the doubts in the message. So you can just type your doubts in the messages. Okay, so are you understanding the facts? Please let me know. Okay, the muscles inserting onto the medial border of scapula, what are the muscles? Whether it is subscapularis muscle, whether it is serratus anterior muscle, whether it is teres minor, latissimus dorsi muscle. So which is the correct answer? Okay, 4 options are there, 4 options are there. Okay. So according to you, which is the best correct answer? So I would like to show you the whole 4 option of the muscles attachments, which will help you to understand. So yes, here we have got the correct answer. Okay, here the correct answer is serratus anterior muscle. Serratus anterior muscle is the correct answer. Actually, serratus anterior muscle is attached, it is arising from the upper 8 and 9 ribs as a 8 or 9 digitations, and it get inserted onto the costal aspect of the scapula on the medial border. Costal aspect of the scapula on the medial border. So yes. Got it? So yes, so serratus anterior is the correct answer. So we have got serratus anterior as the correct answer. Okay, so yes, we have got B as the correct answer. Now my dear aspirants, see here, I would like to show you the images of all the muscles which is mentioned here. So if you will see the origin of the muscle, so origin of the serratus anterior. So here we are talking, so it's the same thing, serratus anterior muscle. Yes. So it is originating from the upper 8 and 9 ribs as shown in the diagram, originating from upper 8 and 9 ribs. Okay. And insertion is onto the medial border of scapula. So this was exactly asked in the MCQ. So clearly you can appreciate it is inserting onto the medial border of scapula. This is the medial aspect of the scapula. So yes, done with this. Now the second option. So let's move on to the other option. Subscapularis muscle. So again I would like to enlarge this image, the subscapularis muscle. If we talk about the, so this is showing you the image of thoracic region from the anterior aspect. So when we are talking about subscapularis muscle, it originates from the subscapular fossa. Subscapularis muscle originates from the subscapular fossa. It originates from the subscapular fossa and it inserts onto the lesser tuberosity of humerus. What about insertion? It is inserting onto the lesser tuberosity of the humerus bone. Now, what was the other option? So, the other option which we have seen was the latissimus dorsi. So, see here, actually latissimus dorsi muscle is having a wide origin. As you can see, it's having an origin, wide origin from the T7 to L5 thoracic and the lumbar, all the lumbar vertebrae and lower 5 thoracic vertebral spine, and also lower down it is originating from the inferior angle of scapula, also from the iliac crest and thoracolumbar aponeurosis. So what you can appreciate that latissimus dorsi muscle is having a large origin, the origin from the lower thoracic vertebrae spine and all the 5 lumbar vertebrae spine, okay, spinous process, and also from iliac crest, also from the thoracolumbar aponeurosis, in a few twigs from few fibers from the inferior angle of scapula, and it is very much thinned out at the inserting point, and it is inserting into the bicipital groove. To be more specific, bicipital groove floor. So actually this latissimus dorsi muscle is the lady between the two major, that is it is inserting into, that means it is inserting into the floor of intertubercular sulcus, which is also called as bicipital groove, in between the teres major muscle medially and pectoralis major muscle laterally. So moving on to the next muscle is teres minor muscle. Okay, so see here, when we are talking about teres minor muscle, it originates from the lateral edge or the lateral border of scapula. Okay, upper part. So this is upper part of lateral border of the scapula and inserts onto the greater tubercle of humerus. Head of humerus, that is to be more appropriate will be greater tubercle of humerus. Actually we have got sits muscle. Okay, so here this is one of the muscle or part of rotator cuff. So यहाँ पे S stands for supraspinatus muscle, I for infraspinatus muscle, and T for teres minor muscle. So these three muscle, teres minor muscle, supraspinatus muscle, infraspinatus muscle, together they get inserts into the greater tubercle of humerus. And when we are talking about the subscapularis muscle, the subscapularis muscle inserts into the lesser tubercle of humerus. Is it okay? So yes, we have done with all the options which is given here. We have done with all options. Let's move on to the next MCQ, that is MCQ number 19. So is it okay? We have done with question number 18 and all the muscles which was there in the option, we have discussed it all. Now let's move on to question number 19. Which of the following is not intracapsular? Which of the following is not intracapsular? Coronoid fossa, radial fossa, olecranon fossa, or lateral epicondyle? Okay, lateral epicondyle. So mark the correct answer. Your time starts now. Okay. Okay, so Rajesh has given A as the correct answer. Rajesh is giving A as the correct answer. Okay, dear Rajesh. Which of the following is not intracapsular? So whether it is for question number 19, actually you should write question number also, so that I will not get confused, because in between only I see the messages. So actually it's the MCQ which is targeting about the attachment of fibrous capsule of elbow joint. So we have to mark which of the following structure is lying outside the fibrous capsule attachment of elbow joint. So in this category we have got lateral epicondyle. Actually both medial and lateral epicondyles are lying outside the attachment of fibrous capsule. Okay, got it? So this is the region, it's not intracapsular. Okay, or coronoid fossa is intracapsular, radial fossa is intracapsular, olecranon fossa is intracapsular. Lateral and medial epicondyle is lying outside the fibrous capsule attachment of elbow joint. So this will be more clear once you see this diagram. So see this, attachment of the elbow joint fibrous capsule has been shown here. So the attachment of fibrous capsule has been shown with a green color pen. So what you can see, the structures which is residing, is, we have got here capitulum is included inside trochlea, radial fossa, trochlear fossa, olecranon fossa, but when we are talking about the lateral epicondyle and that of medial epicondyle, it is lying outside the green line. It is lying outside the green line. Why? Because these two structure is lying outside the green line, because it is lying outside the attachment of fibrous capsule. Got it? So this is quite clear by seeing this image. So all the best. Let's move on to the next one, that is question number 20. So actually today we are going to solve 50 MCQs. Okay. Today we are going to solve 50 MCQs. So the session will continue for another 1 hour more, I think. 1 hour 20 minutes more, 1 hour 10 or 15 minutes, so that we can cover up the entire 50 MCQs. So yes, the structure that lies lateral to distal radial tubercle. So which of the following structure is lying lateral to distal radial tubercle? Option A, extensor pollicis longus, extensor carpi radialis longus, brachioradialis, extensor carpi unlaris. Question number 20th. A, B, C, D, which is the correct answer? Structure lying lateral to distal radial tubercle. Structure lying lateral to distal radial tubercle. So yes, your time starts now. Please mark the correct answer. Four options are there. So Mohit has given A as the correct answer. Structures lying lateral to distal radial tubercle. Okay, okay. What about others? Okay, my dear aspirants, Mohit has given his answer. So actually we know that distal radial tubercle, what is the other name of distal radial tubercle? It is also called as Lister tubercle. The other name of distal radial tubercle is, it is also called as Lister tubercle. It is also called as Lister tubercle. And Lister or distal tubercle is lying on the dorsal aspect of the radius. Where it is located? It is located onto the dorsal aspect of radius bone. Now, actually, the correct answer is extensor carpi radialis longus. So, extensor carpi radialis longus and extensor carpi radialis brevis. So, both ECRL and ECRB are the muscles of second extensor compartment, and the muscles of second extensor compartment will pass lateral to it, will pass lateral to distal radial tubercle, but extensor pollicis longus will pass medial. What is it? Will pass medial. Extensor pollicis longus will pass medially, as it is the muscle of third extensor compartment. It is the muscle of third extensor compartment. If we have to choose one correct answer, we will go with extensor carpi radialis longus and ECRL and ECRB lying lateral to distal radial tubercle. So let me show you this image. So firstly, I would like to show you the location of dorsal tubercle of radius, which is also called as Lister tubercle. So here in this diagram, you can see we are seeing the dorsal or the posterior view of the lower end of the radius and ulna and that of bones of the hand, and you can see Lister or the dorsal tubercle of radius located on the dorsal aspect of the radius bone. Now the next image which I want to share with you is this image where, let me slightly enlarge it. In this image also the so a beautiful diagram. Why? Because this fibrous structure which you are seeing here, what is this? What is this, my dear aspirant? This fibrous structure which you are seeing here is the extensor compartment, is the extensor retinaculum. Okay, this is the extensor retinaculum. So this structure will be the extensor retinaculum. Below the extensor retinaculum, we have got how many? 6 compartments in which the extensor muscle passes. The extensor muscle passes. Now, here firstly we have to know what is this star color structure which you are seeing is DT. What is DT? DT means distal tubercle, distal radial tubercle or Lister tubercle. Now appreciate here. Okay. Appreciate here. Now 2 tendons are passing lateral to it and 1 tendon is passing medial to it. So here, okay, so here if you will see, this is extensor pollicis longus tendon. This is extensor pollicis longus tendon. Okay, so this is extensor pollicis longus tendon, and this extensor pollicis longus tendon is passing, that means this is which tendon? This is EPL tendon, and this is passing medial to it. Why medially? Because you can see this is the ulnar bone, so we know that ulnar bone is medially, and this is the radius bone, and we know that radius bone is laterally. Got it? Now the 2 other tendons, here we can see extensor carpi radialis longus and extensor carpi radialis brevis. So these 2 tendons, extensor carpi radialis longus and that of extensor carpi radialis brevis. So these 2 tendons which you are seeing here, these 2 tendons are passing laterally. Okay, this is ECRB and ECRL. That means both of this, okay, ECRL and ECRB is passing lateral to it, as these are the muscles of second extensor compartment. So please let me know, is this explanation clear? Everyone, those who are listening, is the explanation clear? Okay, so can we move on to the next MCQ? So let's move on to the question number 21. Is it okay, everyone? Okay. So let's move on to question number 21. All are a true statement about brachial plexus except, all of the following are true statement about brachial plexus except lower trunk is formed by root of C8 and T1, lateral cord is formed by upper and middle trunk, okay, posterior cord is formed by posterior divisions of all the 3 trunks, and C4 root is post fixed to the plexus. Okay. Question number 21, 4 options are there. So which is the wrong statement? According to you, which is the wrong statement? These are all the statements about brachial plexus. So according to you, which is the wrong statement? Okay, so yes, let me come up with the explanation. Okay, my dear aspirants. So, okay, I got an answer from Mohit D. Yes, yes, absolutely correct, Mohit. You are absolutely correct. Yes, C4 root is post fixed to the plexus. It's absolutely wrong statement. Why? Why it is wrong? Actually, we know that the formation of brachial plexus is by the ventral rami. So, we know that formation of brachial plexus is by ventral rami of C5, C6, C7, C8 and T1. So this is the common formation. Sometimes what happens, brachial plexus is formed by taking contribution from C4. So when the formation of brachial plexus is formed by taking the contribution of C4, it is called as prefixed, and sometimes brachial plexus formed by taking the contribution from T2. So in that case, it is called as postfix. So okay, so that point I will write. So write down, when contribution of C4 is taken in the formation of brachial plexus, it is called as prefixed brachial plexus, and when T2 contribution is taken, it is called as postfixed brachial plexus. Okay. Other than that, lower trunk is formed by C8 and T1 is absolutely correct. Lateral cord is formed by upper and middle trunk is absolutely correct. And yes, posterior cord is formed by posterior division of all the three trunks is absolutely correct. See here. Now let's see this diagram where you can understand. So study also I have discussed in the session of this anatomy quiz first part, where I have described the brachial plexus. Now here I just want to give you the details of how the formation of brachial plexus takes place. So see here, the roots of brachial plexus, clearly you can see it is formed by C5, C6, C7, C8 and T1. So ventral rami of C5, C6, C7, C8 and T1 is leading to formation of roots of brachial plexus. Trunks may we have got three trunks, superior trunk, middle trunk and inferior trunk. So here, see here, superior trunk is formed by joining C5 and C6, middle trunk is formed by C7, inferior trunk is formed by joining C8 and T1. Now let's see the formation of codes of brachial plexus. Now, see here, lateral cord of brachial plexus formed by anterior division of upper trunk and anterior division of middle trunk. Posterior cord of brachial plexus is formed by joining posterior division of all the three trunks, superior, middle and inferior. And when we are talking about medial cord of brachial plexus, it is formed by anterior division of lower trunk. And the important branches of brachial plexus, that is very important for you to know. Okay, so branches of brachial plexus in detail in the study session we have done. We have already knowing the branches of lateral cord by the mnemonic ML2, medical leave 2, that is musculocutaneous lateral pectoral nerve and lateral root of median nerve. If you remember previous session, we have also discussed the branches of medial cord by a mnemonic lunar or M for you, me for you, M for you, that is 4M for medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of medial nerve and that of medial pectoral nerve, and U for ulnar nerve. Same way, the branches of posterior cord can be memorized by the mnemonic RATS in the upper and lower self. R for radial, A for axillary, T for thoracodorsal, S for upper and lower subscapular, upper and lower self. So done with this, let's move on to the next question number 22. So let's move on to the next, that is question number 22. All the best. Wrong statement about Erb's palsy. Wrong statement about Erb's palsy. Which of the following is wrong statement about Erb's palsy? Okay. Okay, yes, Mohit has asked me one doubt. Ma'am, what is the root for axillary nerve? Yes, why not? So, yes, Mohit, please note down. So, please note down Mohit. So, actually, Mohit, if you want to know the root value of all the nerves, I will quickly tell you about the root value of all important nerves. Okay, so this is a very important question which has been asked by Mohit. So, yes, my dear, axillary nerve root value is C5 and C6. Okay, radial nerve root value is C5, C6, C7, C8 and T1 because it is formed by all the posterior division of all the three trunks. Upper and lower subscapular nerve is having the root value C5 and C6, and nerve 2 LD, latissimus dorsi, which is also called as thoracodorsal nerve. I am writing in short form. Is it okay, Mohit? Okay. Okay, Padaya Bazu, I will just come to that MCQ. Actually, Mohit has asked me one doubt. C6, C7 and C8. Got it? So, these are all the branches of which chord I have written? All the branches of posterior chord. Posterior chord. Now, let's move on all the branches of medial and lateral chord. So, let's move on. Medial chord branches. So, yes. So, medial chord के branches के लिए medial chord branches are ulnar nerve, medial pectoral nerve, medial root of median nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm. Ulnar nerve C8 and T1, please write in bracket C7. For ulnar nerve, you will write C8 and T1 and in the bracket you will write C7. Why? Because C7 is giving innervation to FCU, flexor carpi ulnaris. Medial pectoral nerve C8 and T1. All other nerves of the medial chord is having C8 and T1 as its root value. So, is it clear? Now, we are left with the branches of lateral chord. So, let me write about lateral chord also. Is it okay? So, let me move on to the lateral chord. So, I will utilize the space in writing that. So, branches of lateral chord. Lateral chord branches are musculocutaneous nerve. Okay? And we have got lateral pectoral nerve and we have got lateral root of median nerve. Okay? So, C5, C6, C7, C5, C6, C7, C5, C6, C7. Is it okay? Okay. So, is it okay, Mohit? Okay. So, wrong statement about Erb's palsy. Okay. Okay, dear. So, I got an answer from Baju. C. Loss of pronation at radioulnar joint. So, my dear aspirants, you are absolutely right. Yes, there should be loss of supination. There should be loss of supination, not loss of pronation. So, yes, you are absolutely correct, Padia, Baju. So, now let me explain it. When upper trunk of brachial plexus is injured, the nerve roots which is injured is, the nerve roots which is injured is C5 and C6, upper trunk of brachial plexus. Okay, so let me come with that. So, write down upper trunk of brachial plexus. So, actually when upper trunk of brachial plexus is injured, the root involved is C5 and C6 and here 6 nerves are involved, 6 nerve roots are involved. Why? 6 nerves are meeting here and all like anterior posterior division, suprascapular nerve, nerve to subclavius and upper trunk is involved and the position, the injury will cause Erb's palsy, Erb's Duchenne paralysis. Yes, absolutely right. That is the Erb's point. So, can you see this presentation is waiter tip or policeman tip deformity. Okay, this is what is the presentation of the deformity and the position of so it may be congenital if there is injury during the difficult vaginal deliveries and the position of arm. So, the position of arm in this case will be the arm is in adducted position and the arm is medially rotated. The arm is medially rotated or in adducted position and if you see the forearm is pronated and extended. So, you can see here the forearm is extended and the forearm is extended and pronated and the arm is adducted and medially rotated. This is the position, this is how the presentation will be seen in case of Erb's Duchenne palsy. Erb's point is involved. Absolutely correct. So, let's move on to the next, that is question number 23. Okay, question number 23. Nerve supply of supinator muscle is similar to. nerve supply of supinator muscle is similar to which of the following muscle, whether it is brachialis, whether it is brachioradialis, extensor digitorum or pronator quadratus. So which is the correct one? Okay, nerve supply of supinator muscle is similar to which of the following? Your time starts now. Please mark the correct answer. So, my dear aspirants, supinator muscle is the muscle of extensor compartment. So, this is clear that supinator muscle is the muscle of extensor compartment. This is clear. This is a muscle of extensor compartment. Okay. Now, so that means we have to search for the other extensor muscle in this group. So, only one muscle is the extensor muscle in this group, that is extensor digitorum, and both extensor digitorum being a muscle of extensor compartment and having the same innervation by the deep branch of radial nerve. So, both these muscle is getting innervation from deep branch of radial nerve, and the name of this nerve is pin nerve. PIN, that is posterior introosseous nerve. That is posterior introosseous nerve. My dear aspirants, it is important for you to note down that all the muscles of extensor compartment is getting innervation from posterior introosseous nerve except that of ECRL, that is extensor carpi radialis longus, and brachioradialis. These are the two muscles of, so here brachioradialis is also the muscles of extensor compartment, but it gets innervation from radial nerve. So see here, firstly I will write this innervation. So brachialis. So here so let's move on to this. So here the options are, the muscles are brachialis. Option A is brachialis. So can you tell me the innervation of brachialis muscle? So yes, brachioradialis, other is brachioradialis. I will write about each one of the muscle, and the other is pronator quadratus. I have written in short form. So see here, brachialis muscle is an example of hybrid muscle. So its innervation is from both musculocutaneous nerve, that is the nerve of anterior aspect of arm, along with radial nerve. Yes, Bazu. And brachioradialis is directly by radial nerve. Actually, two muscles in the extensor compartment, both ECRL, extensor carpi radialis longus, and brachioradialis. These are the only two muscles of the extensor compartment which is getting directly innervations from, radial nerve. All other muscles are getting innervation from deep branch of radial nerve, that is posterior introosseous nerve. Now, pronator quadratus muscle is the deep muscle of anterior compartment of forearm. So, it gets innervation from deep branch of median nerve. Now, my dear aspirants, no, pronator quadratus is the muscle of anterior compartment. Baju, it's a muscle of anterior compartment. So, it will get innervation from deep branch of median nerve, and that is called as anterior introosseous nerve. So, its innervation will be anterior introosseous nerve. So, yes, is it okay? Okay, so okay, let's move on to the next, that is question number 25th. Oblique cord is related to supinator, long flexure, short flexors, or lumbricals. So, which is the correct one? Okay. The next MCQ is about oblique cord. So, oblique cord is related to, okay, your time starts now. Oblique cord is related to which of the following? So, waiting for your answer. Okay. Okay, please mark the correct answer. Your time starts now. Oblique cord is related to. Okay, I got an answer. No, the correct answer is supinator. Question number 24, supinator. Oblique cord is related to. The correct answer will be supinator. Is it okay? Got it? So yes, let me explain what is oblique cord. Oblique cord is a ligament between, so see here, oblique cord is a ligament between ulnar and radius bone in the forearm near the elbow. Okay, oblique cord. Okay. Okay, so yes. Oblique cord is a ligament between ulnar and radius bone in the forearm near the elbow. It takes the form of small flattened band extending downwards and laterals from the lateral aspect of ulnar tuberosity at the base of coronoid process to the radius. Okay, just little below the radial tuberosity. Okay. So, it's okay. Okay, so yes, we will actually, it is important to know the definition of supinator oblique cord. Actually, when we are talking about oblique cord, it is forming a connection between the two bones of the forearm, that is radius and ulna. So, it is extending between the ulnar and radius bone and it is connecting the forearm bone near the elbow. So, it is actually an extension which is going in downwards and lateral direction. It extends from the ulnar tuberosity. It is extending from the ulnar tuberosity at the base of coronoid process to the radius bone little below the radial tuberosity. Little below the radial tuberosity. Got it? Its fibers run in opposite direction to the intraosseous membrane. Please note down the direction of the fibers of intraosseous membrane and that of the fibers of oblique cord is just opposite to each other. Let me show you a diagram and it is quite closely related to that of supinator muscle. So, see here, actually on the proximal superior aspect we have got supinator muscle. So, let me show you, this is exactly oblique cord. This is exactly oblique cord. It is forming a connection between the ulnar tuberosity, it is a connection between ulnar tuberosity and going towards the radius bone, forming a connection, and proximally at this level we have also got the supinator muscle. So, it is related to supinator muscle. Let us move on to, yes, I got the correct answer A. Let us move on to the next question, number 5th. Okay, which of the following joint is paired correctly with the type of joint? Which of the following joint is paired correctly with the type of joint? A. Proximal and distal radioulnar joint, condyloid synovial joint. Radiocarpal joint is pivot synovial joint. Intercarpal joint is plain type of synovial joint, and metacarpophalangeal joint is hinge synovial joint. Interphalangeal joint is condyloid synovial joint. So, according to you, which is the correct answer? Question number 25, please mark the correct answer. Your time starts now. Question number 25th. Okay, so according to you, which is the correct pairing? The joint and the type of joint, which is the correct pairing? So, please mark the correct answer. Your time starts now. Okay. Yeah. So here intercarpal joint is plain type of synovial joint and it is the correct answer. It is the correct answer. Okay. It is the correct answer. Intercarpal joint is plain type of synovial joint. It's the correct answer. Intercarpal joint is plain type of synovial joint. Got it? Question number 25. Okay, my dear aspirants, about the other joint, proximal and distal radioulnar joint is condyloid joint is wrong. It is pivot type of synovial joint. Radiocarpal joint, which is also called as wrist joint, and structurally it is an example of condyloid joint, but functionally radiocarpal joint is an example of ellipsoid variety of synovial joint. So please note down, it is important for you to know that wrist joint is ellipsoid variety of synovial joint, but it is functional classification. If we talk about structural classification, it is condyloid type of synovial joint. Metacarpophalangeal joint is hinge joint. It is written here that metacarpophalangeal joint is hinge joint, but my dear aspirants, it is ellipsoid variety of synovial joint. Functionally, okay, structurally condyloid hai, but functionally ellipsoid hai. Structurally again interphalangeal joint is hinge joint. Interphalangeal joint will be hinge variety of synovial joint. So let's see the similar thing. So proximal and distal radioulnar joint, what I have written, pivot type of synovial joint, radiocarpal joint, wrist joint, condyloid joint. Please note down, it is structural classification. If we talk about its functional classification, अगर मैं functional classification की बात करूँगी, so functional classification is ellipsoid joint. Intercarpal joint is plain type, which was correct. Metacarpophalangeal again condyloid, तो ये कौन सा हुआ, structural हुआ. अगर मैं functional बोलूँगी तो again it is ellipsoid variety. Interphalangeal joint is hinge variety. So is it clear? Any doubt? Please let me know. Is it clear? Okay. So let's move on to the next, that is question number 26th. Which is true regarding the carpus bone? Which of the following is the true statement about carpus bone? Scaphoid articulate proximally with ulna and has got tubercle. Lunate articulate with ulna and is broader anteriorly than posteriorly. Triquetrum articulate proximally with articular disc of distal radioulnar joint. Pisiform lies on the palmar surface of trapezium and it is composed of 7 carpal bones. So according to you, which is the correct one? Got it? Okay. So which is true regarding carpus? Okay, your time starts now. So actually the correct statement is triquetrum articulate proximally with the articular disc of distal radioulnar joint. So we have got C as the correct answer. Here C option is perfectly correct. Triquetrum is articulating proximally with the articular disc of distal radioulnar joint. C is absolutely correct answer. All other options are not correct. So yes, scaphoid articulates proximally with ulna is absolutely wrong. It should, absolutely correct Mohit. So actually scaphoid articulate with radius bone, not with the ulna, it articulate with the radius bone. Lunate is also articulating with the radius bone and it will be, pisiform is lying on triquetrum bone. Pisiform is resting on triquetrum and there is 8 carpal bones, not 7 carpal bones. So let me show you the explanation here. So see here. Scaphoid articulates, the same thing, scaphoid articulates with the radius bone and has got a tubercle. So this is the correct statement. When we are talking about the lunate, it articulates with the radius and is broader anteriorly than posteriorly. Triquetrum articulates proximally with the articular disc of distal radioulnar joint. With the distal radioulnar joint. Got it? Pisiform lies on the palmar surface of triquetrum. Just now I have told you it is located on the palmar aspect of triquetrum bone. So, got it here. Now, I would like to show you the same with an image so that you can better understand. Okay, so let's see this image. So, here, okay, let me slightly enlarge this so that you can understand correctly. So, actually when we are talking about the bones, this is the lower end of the forearm bones, that is the radius and the of the ulnar bone. Okay. So, we have got radius and that of ulnar bone. Now, that means this is the lateral side and this is the medial side. This is the medial side. Okay. This is the lateral side and this is the medial side. Okay. Now, the bones. So, let's start with the bones. So, we are talking about the bones. As we start from lateral to medial, we have got 4 proximal row of the bones. So, what are they? These are 4 proximal rows. So, now the first lateral most bone, so actually the mnemonic is "She looks too pretty, try to catch her." This is the mnemonic. So, here C, S stands for scaphoid bone, S stands for scaphoid bone. The next is the L stands for lunate bone, T stands for triquetrum, and over the triquetrum the pisiform bone is resting. So, we have done with the proximal row. So, these are all what? Proximal row. Now, let us talk about the distal row. So, now T, T, C and H. Okay. So, now we will talk about, so this is about the distal row and this firstly I have written about the proximal row. Now, let us talk about the distal row. So, yes, in the distal row we have got T for trapezium, lateral most, then we have got the trapezoid, then we have got the capitate and the medial most is the hamate. Okay. So, see here, trapezium, trapezoid, trapezium, trapezoid, the largest carpal bone, the capitate, and we have got the hamate with a hook. So, this is all about the carpal bone, and very clearly we are seeing the scaphoid bone and the lunate bone is articulating with radius, the pisiform is small P-shaped bone is resting over the triquetrum, and trapezoid, trapezium, capitate, hamate are the distal row of carpal bones. So, yes, done with this. Now, let us move on to the next, that is question number 27th. Let us move on to question number 27th. All the best here. Sternoclavicular joint is, option A is saddle type of synovial joint but functions as ball and socket type of synovial joint. Option B is supplied by lateral thoracic and thoracoacromial arteries. It is innervated by lateral medial pectoral nerves and its articulation of clavicle and gladulus of sternum dislocates easily. So, sternoclavicular joint. So, this is about sternoclavicular joint. So, mark the correct answer. Your time starts now. So, I got an answer from Suchitra and Mohit. Both are giving A as the correct answer. Absolutely correct. Absolutely correct. Question number 27th, I have got Mohit and Suchitra. Both of you have given the right answer, that is A. So, yes, if we talk about sternoclavicular joint, it is having 2 definitions. So, it's a structurally agar hum bole to it is an saddle type of synovial joint, but functionally it functions as a ball and socket type of joint. So, that means functionally it is having 3 degrees of movement and more than 2 planes of the movement. All other points are absolutely wrong about sternoclavicular joint. Actually, the word gladulus means body of the sternum, and we know that sternoclavicular joint is an articulation with the manubrium part of the sternum and it is not dislocating easily. So, these are all wrong. Nerve supply and arterial supply is also wrong about sternoclavicular joint. Let me give you the detailed anatomy of sternoclavicular joint. When we are talking about sternoclavicular joint, it dislocate easily is not correct. Actually, dislocation is rare in case of sternoclavicular joint. It is saddle type of synovial joint but functions as ball and socket type of synovial joint. The articulation is not between the body of sternum, actually it is an articulation between the sternal end of clavicle and the manubrium sterni. The joint is supplied by internal thoracic and suprascapular artery. Please note down. The arterial supply is by internal thoracic and suprascapular artery. Internal thoracic is a branch of subclavian artery, and internal thoracic and that of suprascapular artery. Internal thoracic artery is a branch of first part of subclavian artery, and suprascapular artery is a branch of thyrocervical trunk, which is also a branch of first part of subclavian artery. The nerve supply is by median supraclavicular and nerve to subclavius. So absolutely okay. So we have done with the nerve supply and arterial supply of sternoclavicular joint. Let's move on to the next, that is question number 28. Which is not true statement about brachialis muscle? Which of the following is not a true statement about brachialis muscle? Its origin is distal. It originates from distal half of anterior surface of humerus. It inserts onto coronoid process and tuberosity of the ulna, and it flexes the forearm in all position. It is primarily innervated by musculocutaneous nerve, but some of its lateral part is also getting innervation from radial nerve, and it crosses two joints. So according to you, which is the incorrect statement about in respect to brachialis muscle? Question number 28. Okay, question number 28. Please mark the correct answer, which is not a true statement about brachialis muscle. Okay, so it crosses to, okay, C. It flexes the forearm in all position. Actually, the incorrect option is E. It crosses two joint. It is just crossing one joint, that is elbow joint. Brachialis muscle is crossing just one joint, that is elbow joint. It is not crossing two joint. All other option is absolutely correct. Yes, we know that the origin of brachialis muscle is from anterior distal half of the humerus. Insertion is in the ulnar bore, ulnar tuberosity, coronoid process, and it is one of the prime flexors of the forearm in all position. Its innervation is by musculocutaneous nerve and also by the branch of radial nerve. Absolutely correct. So only we have got brachialis muscle as the example of hybrid muscle. Okay, so yes. Now let's give me further explanation. When I am talking about a brachialis muscle, it is one of the muscle of anterior aspect of the arm. It originates from the distal half of anterior surface of the humerus. Yes, it is originating from the distal half of anterior surface of humerus and inserts into the coronoid process of or tuberosity of ulna. Okay, now it crosses one joint and flexes the forearm in all positions. So yes, absolutely correct. It crosses one joint, that is elbow joint. Okay. While it primarily is innervated by musculocutaneous nerve, some of its lateral part is innervated by branch of radial nerve. So yes, it is primarily getting innervation by musculocutaneous nerve, and its lateral part is getting innervation from radial nerve. So that only explain that it is a muscle of composite, or it is also called as composite or hybrid muscle, because it is getting dual nerve supply, and it is just crossing one joint, that is elbow joint. So is it okay? Understood? Let's move on to the next, that is question number 29. A patient cannot raise the trunk as in climbing. What is the most likely the problem with the patient? The patient is not raising the trunk as in climbing. So you have to understand which movement actually this climbing movement is required. Okay, a patient cannot raise the trunk as in time. So which is the most commonly involved? The options are damage to ventral rami of C5, C6, C7, paralysis of latissimus dorsi, injury to dorsal scapular nerve, damage to dorsal rami of C8 and T1, and injury to axillary nerve. 5 options are there. So mark your correct answer. Question number 20. Anuj Srivastava has given his answer as E. Okay. Okay, my dear aspirant. Actually, the correct answer for question number 29th is question number 29th. It's B, paralysis of latissimus dorsi. Yes, youth of Bharat, absolutely right, Mohit. It's paralysis of latissimus dorsi. Actually, clamping is like this. So what is the action involved? So when I am talking about clamping movement, it involves medial rotation and adduction. Medial rotation and adduction of arm. So can you tell me medial rotation, adduction of arm and extension of forearm is basically these extension of forearm. So this is exactly the movement which is seen in case of clamping movement. So when we are talking, so if we see the action of latissimus dorsi muscle, which is if we talk about its action, the action of latissimus dorsi muscle is it causes medial rotation and adduction of arm, and it causes extension of forearm. It causes extension of forearm. So that means which muscle is involved? Latissimus dorsi, and we know that the latissimus dorsi innervation is by nerve to latissimus dorsi, which is having the root value C6, C7 and C8. So we have got B as the correct answer. Okay. Okay, got it? Paralysis of latissimus dorsi. So we have got B as the correct answer. So we have got B as the correct answer. So absolutely correct, my dear aspirants. So let me show you. With the paralysis of latissimus dorsi muscle, the patient is unable to raise the arm, which is important for the clamping movement. Okay, the cause could be injury to thoracodorsal nerve, which is also called as nerve to latissimus dorsi. And if you remember, I told you nerve to latissimus dorsi is a branch of posterior cord of brachial plexus, and its nerve supply or its root value will be C6, C7 and C8. Is it okay? Are you understanding? Any doubt, please be free to ask me. Any doubt, my dear aspirants, you are free to ask me. Please let me know. Got it? So let's move on to the next, that is question number 30th. Deep artery of arm accompanies which nerve before passing around the body of humerus, before passing on to the body of humerus, whether it is radial, whether it is musculocutaneous, whether it is median, ulnar or axillary. Deep artery. Deep artery of arm means other name is profunda brachii artery. So I will give you another hint. Deep artery of arm means profunda brachii artery, and profunda brachii artery is the branch of brachial artery. Brachial artery. So I got an answer from Suchitra, B, musculo. Okay. What about others? What about others? So hint hai, deep artery of arm means profunda brachii artery, and it is running along with which of the following nerve? Okay. The correct answer is radial. The correct answer will be radial. So deep artery of arm, that is profunda brachii artery, it is running in the radial groove along with radial nerve. So we have got A as the correct answer. We have got A as the correct answer. So my dear aspirants, please note down that deep artery of arm is running along with radial nerve in the radial groove, and which is also called as the spiral groove, and radial or spiral groove is the location which is lying in the posterior aspect of the humerus, Okay, so let me show you this diagram. So let me just highlight this diagram. So see here, my dear aspirants, if you are appreciating this diagram, this is the posterior view of the scapula which you are seeing. This is the posterior view of the scapula which you are seeing, and where we have got few of the spaces, scapular spaces are seen here. So I would like to Explain it. Okay. So my dear aspirants, if I enlarge this diagram, what you can clearly appreciate here, 4 spaces are there. So this is one space, this is one space, and this is one space. Okay. So that means there is, this is US, this is US means upper triangular, no, UT I will write. This is UT, that is upper triangular space, this is LT lower triangular space, and this is QS quadrangular space. Now, from this lower triangular space, 2 structures, that is one nerve and one artery, that is profunda brachii artery and radial nerve, is traversing in radial groove. So, यहाँ पे हम 2 structures देखते हैं. One is radial nerve. So, one is radial nerve and the other is profunda brachii artery. So, these 2 structures. So, these 2 structures, that is radial nerve in the groove and the profunda brachii artery, these 1 and 2 structures is passing from the lower triangular space and reaching the spiral groove. So, this was asked in the MCQ. Got it? Now, abhi 2 structures. Okay, so quadrangular space, you can see here from the quadrangle, if I am targeting this quadrangular space, this is quadrangular in space, here 2 structures are lying here, and these 2 structures, one is posterior circumflex humeral artery, and the other is nerve, that is the axillary nerve. So, these 2 structures, that is the axillary nerve. So, these 2 structures are passing through quadrangular space. And my dear aspirants, here I just want to add only one structure. So, let me just use this color so that it will be very clear. This is only one structure passes through upper triangular space, and this is one artery. The name of that artery is, it is called as circumflex scapular artery. So, circumflex scapular artery is passing through upper triangular space. This is the branch of subscapular artery. So, is it clear? That means we have seen, with this diagram, we have seen all the important structures passing through the quadrangular and the 2 triangular spaces in the back of the scapular region, and from the lower triangular space, the structure residing in the spiral groove. The MCQ was about spiral groove. So, structures residing in the spiral groove, this is exactly the location of the spiral groove. This structure is radial nerve and the profunda brachii artery. Got it, everyone? Let's move on to the next question, number 31. Okay, so let's move on to question number 31. Question number 31. Nutrient artery runs in option A, towards metaphysis, away from metaphysis, away from epiphysis, or none of the above. Okay, so let's move on to question number 31. Question number 31. Please mark question number 31. Okay, question number 31. Okay, nutrient artery runs. What is the exact direction of the nutrient artery? 4 options are there, my dear aspirants. Please mark the correct answer. Okay, I got an answer from Basant Adi. He is telling D. What about others? What about others? So, my dear aspirants, the correct answer will be, it runs towards, the direction of nutrient artery is towards the metaphysis, Actually, what happens, nutrient artery, when I am talking about nutrient artery enters the long bone through nutrient foramen, It will traverse through the nutrient foramen and will divide into ascending and descending branches. So, it will divide into ascending and descending branches, it will move in upper and lower direction and will anastomose with the other neighboring arteries, that like epiphyseal arteries, metaphyseal arteries, and also the perosteal arteries. Okay. So, yes, let's move on to question number 31. See here, nutrient artery and the vein, when we are talking about nutrient artery and the vein, this will enter via nutrient foramen and will pass in ascending and descending direction inside the shaft of the compact bone through the nutrient foramen, and they can anastomose with the metaphyseal arteries, epiphyseal arteries, and also perosteal arteries. So is it okay? We have done with this. Let's move on to question number 32. Okay, parasympathetic fibers from ninth cranial nerve synapses in which ganglion before traveling to parotid gland? Otic ganglion, ciliary ganglion, submandibular, pterygopalatine. Mohit, ma'am, my A and answer was question number 31A. Okay, great. So it is correct, Mohit. It's correct, Mohit. It's correct, Mohit. Yeah, I didn't. So okay. So okay, my dear Aswin, please write like 31 type. No, so I will not get to him. So it's good. It's good, Mohit. It's good. Okay. So let's move on to question number 32. So please mark the correct answer for question number 32. Okay. So everything is important is participation and revision. Okay, I am not here for judging who is marking it correct and false. So I just want everyone should participate and mark anything. If they are not knowing, they can say, ma'am, start explaining. Okay, so only I quickly start explaining only each and every MCQs. Okay, don't worry. So question number 32, actually the correct answer here is otic ganglion. Otic ganglion. So if we will talk about the parotid gland, parasympathetic innervation, that means that carries secretomotor fibers, to parotid gland. Okay, so that carries secretomotor fibers to parotid gland. So actually these fibers will traverse along the otic ganglion and they will give innervations to parotid gland. So that is, let me explain this via one diagram and via flow chart. So see here, the through inferior salivary nucleus. What is inferior salivary nucleus? Inferior salivary nucleus is a So yes, inferior salivary nucleus. When we are talking about inferior salivary nucleus, this is the nucleus of origin of which is carrying traversing secretomotor fibers to parotid gland. So it takes origin, as you can see from the, it is written, actually it should be taking origin from the part of pons only, and then from here it will traverse along glossopharyngeal nerve, tympanic branch and tympanic plexus, and these fibers will relay into otic ganglion. These fibers will traverse and relay in the otic ganglion. From here the fibers will pass via lesser petrosal nerve and via this fibers via auriculotemporal nerve give innervation, secretomotor innervation to parotid gland. See here, the correct flow chart also I have shown here. Inferior salivary nucleus, as I told you, it is located in the pons. Preganglionic fibers arises via glossopharyngeal nerve. Tympanic branches forms tympanic plexus, lesser petrosal nerve. The fibers which will relay into which ganglion? Otic ganglion. This is important. And from here postganglionic fibers arises via auriculotemporal nerve will supply or give secretomotor innervation to parotid gland. Let's move on to question number 33. So this is question number 33. Question number 33. All of the following are the contents of occipital triangle except. All of the following are the contents of occipital triangle except. Great auricular nerve, suprascapular nerve, lesser occipital nerve, occipital artery. Which is the correct answer, dear? Which is the correct answer? Please mark it. Alok Shah, 33A. No. The correct answer is B, suprascapular nerve. Actually, great auricular nerve, it's a cutaneous nerve. It's a cutaneous nerve and it is also forming the content for the roof and coming from below of, it is forming a content of roof and coming also forming the content inside of the occipital triangle. So, suprascapular nerve is the right answer because it is the content of subclavian triangle. Actually, and all other are the contents of occipital triangle. So, for understanding this, I would like to show you a diagram which will help you to understand. Actually, when we are talking about posterior triangle of the neck, it is divided into upper triangular space and the lower triangular space. So, let me just highlight this diagram. So, this whole is, so see here, this whole is a posterior triangle. This whole is a posterior triangle. Now, the posterior triangle is formed between, this is sternocleidomastoid muscle anteriorly and this is trapezius muscle posteriorly. Now, again there is one muscle here, this is the inferior belly of omohyoid. This muscle is inferior belly of omohyoid. See here, this muscle is inferior belly of omohyoid. So, this is inferior belly of omohyoid, and inferior belly of omohyoid is dividing it into two triangular space. See here. So, inferior belly of omohyoid will divide this this posterior triangle into two triangular space. So, here I will use, there is one upper triangular space, this is the occipital triangle, okay, and the lower triangular space, which this is the lower triangular space, and this triangular space will be the subclavian triangle. Now, see the contents. So, अभी हम क्या बात करेंगे contents की. So, the contents of the occipital triangle are, it is containing occipital artery, it is containing occipital artery, it is containing occipital lymph node, it is containing spinal accessory nerve, it is containing 4 cutaneous nerve is sprouting out. What are these? So, we have got 4 cutaneous nerve which is sprouting out from the from this triangular space, that is occipital triangular space, that is upper triangular space of this area. See here. So, here this is supraclavicular nerves, okay. So, see here, supraclavicular nerve, greater lesser occipital nerve and that of spinal accessory nerve, all these structures, transverse cervical nerve, all these structures or nerves are lying there along with the lymph nodes. These are what? These are the lymph nodes which is residing. Okay, these are all lymph nodes, occipital lymph nodes. Got it? So, these are important contents for the upper triangular space. So, here this is all content for the occipital triangle. Now, this triangular space, so here this is the inferior belly, this triangular space, this small triangular space is the subclavian triangular space, okay. So, this is subclavian triangular space. Why subclavian triangle? Because it is containing subclavian artery and subclavian vein. So, this is subclavian artery, lower part we have got the subclavian vein also. So, see here. So, we are having subclavian artery and we have having subclavian vein. Also, the trunks of brachial plexus. So, we have got upper, medial and these are upper, middle and the lower trunk of brachial plexus, which is also the content. And nerve, suprascapular nerve was mentioned, no, my dear aspirants. So, see here, suprascapular nerve was mentioned. Why it is wrong? And you are absolutely knowing that suprascapular nerve is the branch from which triangle, from which trunk, upper trunk. So, we know that suprascapular nerve is a branch from upper trunk of brachial plexus. It is a branch from upper trunk of brachial plexus and we know that upper trunk of brachial plexus is the content of subclavian triangle. So, we have got B as the right answer. Got it? Let us move on to the next question number 34. Okay, question number 34. Inferior thyroid artery arises from, option A, first part of subclavian artery, option B, internal carotid artery, third part of subclavian artery, thyrocervical trunk, that is a branch from the first part of subclavian artery. Question number 34. Inferior thyroid artery arises from which part? So, which is the most appropriate answer for question number 34? Suchitra has given the answer. Absolutely correct, Suchitra. You are absolutely correct. Yes, absolutely correct, Suchitra. It's a branch from thyrocervical trunk, which is again the branch from the first part of subclavian artery. Absolutely correct. Okay. So, let me show you. Actually, first part of subclavian artery is also correct, but if D is given, then we will go with D as a most better answer. So, see this diagram. Inferior thyroid artery. So, let me just highlight it. So, you can see here it is written first, second and third. It is written, as you can see in this diagram, it is written first, it is written second and it is written third. Why? They are dividing the So subclavian artery into 3 parts. Okay, so into 3 parts, and we know that subclavian artery is divided into 3 parts by which muscle? Which muscle? Scalenus anterior muscle. Scalenus anterior muscle divides subclavian artery into how many parts? 3 parts. Into 3 parts. Now see here. Now branches from the first part is we have got vertebral artery. Branches from the first part is vertebral artery. Then we have got thyrocervical trunk. Then we have got internal thoracic artery. See here. So direct branches from the first part is 3 direct: vertebral, thyrocervical trunk and that of internal thoracic artery. These 3 branches are the direct branch from the first part, as we can see in this diagram. Now further branches, so here actually thyrocervical trunk, further branches have also been shown. So further branches of thyrocervical trunk is transverse cervical artery. It is also having inferior thyroid artery. Inferior thyroid artery is shown here, transverse cervical, inferior, and suprascapular artery. So see here, these are again further branches from the first part through thyrocervical trunk. Branches from the second part. So see here, if I go with the branches from the second part, costocervical trunk is the branch from the second part. So costocervical trunk is the branch from the second part. And the third part, if we talk about the third part, from the third part we have got just one branch that is also not always present, that is dorsal scapular artery. So dorsal scapular artery is a branch from the third part of subclavian artery that is also not always present, but at times it can be present. Okay, so its origin of dorsal scapular artery is quite variable. So thyrocervical trunk, part of first part of subclavian artery, is giving inferior thyroid artery. Let's move on to the next question, number 35. Now, all muscles of the tongue are supplied by hypoglossal nerve except, easy one. Question number 35. All muscles of the tongue are supplied by hypoglossal nerve except genioglossus, palatoglossus, styloglossus, hyoglossus. Which is the correct one? Which is not getting innovation from all muscles of the tongue are supplied by hypoglossal nerve except, which is not getting innervation from hypoglossal nerve. Please mark the correct answer. Okay, the correct answer is B, platoglossus. Question number 35, we have got the correct answer B, platoglossus. Actually, yes, Suchitra, you are absolutely right. Again, you have made a correct answer, dear Suchitra. Absolutely correct, dear. Yes, absolutely correct. So palatoglossus, yes. So when we are talking about palatoglossus muscle, it is getting innervation from, okay, Aloksha, okay, I think you are getting confused with stylopharyngeus. So actually stylopharyngeus is from glossopharyngeal nerve. Palatoglossus is getting innervation from vagus nerve, which is also carrying the fibers of cranial part of accessory nerve. All other genioglossus, styloglossus, all is getting innervation by 12th cranial nerve. Actually, when we are talking about all the muscles of the tongue, that is, we know that extrinsic and intrinsic muscles, we have got genioglossus muscle, we have got hyoglossus, styloglossus and chondroglossus. All these muscles are getting innervation from 12th cranial nerve except the platoglossus from the vagus along with the cranial part of accessory, along with accessory nerve cranial part. Got it? Let's move on to the next question, number 36. Which of the following is a derivative of Richard's cartilage? Which of the following is derivatives of Richard's cartilage? Stapes, malleus, incus, phenomandibular joint. Question number 36. Which of the following is a derivative of Richard's cartilage? Four options are there. Mark the correct answer. Question number 36. Incus, oh, okay. Incus is also a derivative of first cartilage only. Actually, the correct answer is stapes. Okay, my dear aspirant, the correct answer will be stapes. Actually, stapes is getting origin from the second. So, if we talk about stapes is the smallest ear ossicle, and it is getting innovation from second cartilage. It is getting innovation from, it is a derivative of second pharyngeal arch. So, if we have to mark the correct answer, we will go with stapes as the correct answer. Okay, rest all malleus incus and sphenomandibular joint as the derivative of first pharyngeal arch. Okay, don't worry, no worry, I will tell you. Cartilage. So, don't worry, for your MCQ, please revise all the derivatives of second pharyngeal cartilage. For your MCQ, for your examination, please revise all the derivatives of second pharyngeal arch, that is Richard's cartilage. The derivatives of second pharyngeal arch or Richard's cartilage includes stapes. So, all these starts from S. Stapes, styloid process, stylohyoid ligament, small corona of hyoid bone and superior part of hyoid bone. All these 5 structures are derivatives of Richard's cartilage. Got it? Stapes, styloid process, stylohyoid, smaller corner of hyoid bone, superior part of the body of hyoid bone. All these are derivatives of second pharyngeal arch. Okay, let's move on to the next. Easy one. Weiden nerve is, what is the other name of Weiden nerve? So, you will get the 30 seconds, please mark the correct answer. Weiden nerve is also called as mandibular nerve. It is also called as deep petrosal nerve. It is also called as nerve of pterygoid canal or lesser petrosal nerve. According to you, which is the correct answer? Four options are there. Okay, yeah, absolutely correct, Suchitra, absolutely correct. It is Weiden nerve is also called as, absolutely correct, Suchitra, Weiden nerve is also called as nerve of pterygoid canal. Okay, absolutely correct, yes. So, actually when we are talking of Weiden nerve, it is also called as nerve of pterygoid canal. And it is formed by joining, two nerves. Okay, it is formed by joining two nerves. What is it? It is formed by joining greater petrosal nerve and deep petrosal nerve. I am writing in short form. So, greater petrosal nerve is formed by, it is the branch of facial nerve. Okay, and deep petrosal nerve is formed by sympathetic plexus surrounding ICA, internal carotid artery, sympathetic plexus surrounding internal carotid artery. Got it, everyone? So, we have got C as the correct answer. Now, let's move on to the next, that is question number 38. Branch of anterior division of mandibular nerve is, which of the following is branch of anterior division of mandibular nerve? Meningeal, mesenteric, auriculotemporal or lingual? Branch of anterior division of mandibular nerve. Meningeal, mesenteric, auriculotemporal, lingual. Question number 38. Mesenteric, absolutely correct, absolutely correct. Okay, yes, mesenteric nerve is a branch of anterior division. It's a branch of anterior division of mandibular nerve. Actually, muscular branches are is more from the anterior division, motor branches. Okay, so yes, and let me show you a diagram for it. Absolutely correct. So, let me show this diagram for you. So, if I enlarge this, you can clearly appreciate the branches. Slightly more I can enlarge. So, is it okay? Yeah, see here. So, my dear aspirants, see here, if we talk about mandibular nerve, so mandibular nerve is passing through foramen ovale, that is known to you. It is passing through the foramen ovale actually, and it is giving following branches from the anterior division. So its branches from anterior division I want to highlight here. The branches of anterior division is masseteric, deep temporal, nerve to lateral pterygoid and buccal. Among this only one branch, this buccal, is sensory. So among this only buccal nerve is sensory, and rest all the nerves, that is lateral pterygoid, branch to lateral pterygoid, deep temporal, masseteric, are all motor. Now let's talk about the branches of posterior division. Branches of posterior division may we have got inferior alveolar nerve, we have got auriculotemporal nerve, and we have got lingual nerve. So see here. Here, my dear aspirants, basically auriculotemporal nerve, inferior alveolar nerve, and that of lingual nerve. All these are mainly sensory. These all nerves are mainly sensory. Only the one, that is inferior alveolar nerve, gives one motor branch. So it is giving one motor branch, that is called as nerve to mylohyoid. Basically the posterior division branches. So these are all posterior division branches of mandibular nerve, and in posterior division branch majority of the branch are sensory, auriculotemporal, lingual, inferior alveolar also, but inferior alveolar nerve is giving one branch, that is nerve to mylohyoid, which is motor. So is it clear to everyone? Clear, my dear aspirants? So yes, let's move on to question number 39. Okay. Galen anastomosis is lying between. What do you mean by the word Galen anastomosis? Okay. So yes. Recurrent laryngeal nerve, it's an anastomosis which is occurring between recurrent laryngeal nerve and external laryngeal nerve, or recurrent laryngeal nerve and internal laryngeal nerve, internal laryngeal and external, or none of the above. Question number 39. Galen anastomosis. So let me explain you. Actually, generally anastomosis occurs between the arteries, but this is an anastomosis of the nerve, and it takes place between recurrent laryngeal nerve. It is an anastomosis between recurrent laryngeal nerve and internal laryngeal nerve, which is a branch of superior laryngeal nerve. I would like to show you a diagram for it. So we have got B as the correct answer. So my dear aspirants, just see, I will enlarge this diagram. Here you can appreciate the anastomotic region. This is the anastomotic region, and here you can clearly see the branches of internal branch of superior laryngeal nerve. So you can see here, these are the branches. So I will use black color so that it will be more easy for you. So these are the branches from internal laryngeal branch of superior laryngeal nerve. The other one is recurrent laryngeal nerve. So when you see, these are the branches from the recurrent laryngeal nerve, the branches is also anastomosing. So and this anastomosis is called as Galen anastomosis. So you can see here, Galen anastomosis is an anastomosis taking place between internal branch of superior laryngeal nerve, that is internal laryngeal nerve, and the other nerve is recurrent laryngeal nerve. Got it? Now let's move on to the next question number 40. During thyroid operation, so during thyroid operation, okay, during thyroid operation, the nerve which is coursing along with superior thyroid artery is injured. So which can be the possible consequences of this? What can be the possible consequences of this? Loss of sensation above the vocal cord, loss of sensation below the vocal cord, paralysis of lateral cricoarytenoid muscle, or paralysis of cricothyroid muscle. Question number 40, which is the correct answer? So yes, Suchitra is telling C, okay, and okay. So let me explain you, don't worry. So actually for solving this MCQ rightly, you have to know that superior thyroid artery. So we have got thyroid artery, we have got superior thyroid artery, and we have got inferior thyroid artery. So actually when we want to remove the thyroid gland, we have to keep in mind the important nerves which is related with this thyroid artery. Superior thyroid artery is running along with external laryngeal nerve, and inferior thyroid artery is running along with recurrent laryngeal nerve. Okay, that means in this case which superior thyroid artery is ligated. So the nerve which will be injured. So which nerve will be injured in this case? External laryngeal nerve. In this case external laryngeal nerve will injured, and we know that external laryngeal nerve supply which muscle? Cricothyroid muscle. It is supplying only one muscle, intrinsic muscle of the larynx. So D is the correct answer. We know that external laryngeal nerve is giving innervation to just one muscle of the larynx, that is cricothyroid muscle. So it will lead to the paralysis of cricothyroid muscle. Okay. So my dear aspirants, see this diagram which will help you to understand. So let me just show you the important relations also here. So you can see in this diagram that this is superior thyroid artery. Superior thyroid artery is running along with, as you can see here, external laryngeal nerve. So it is running along with external laryngeal nerve. Okay, see this diagram. This is external laryngeal nerve which is running along with superior thyroid artery. So अगर superior thyroid artery injured होती है तो external laryngeal nerve is involved. That means, okay, if I enlarge this diagram, it will be clearly visible to you. Okay, that means another important point which you can clearly see in this image is that one point, it is written one here, that is thyroid artery के apex पे at the apical part or apical part we have got superior thyroid artery which is running close to that of external laryngeal nerve. Now see the basal aspect, this is point 2. So at this position you can see inferior thyroid artery is running along with left recurrent laryngeal nerve. So see here, यहाँ पे क्या हुआ है, this is the left recurrent laryngeal nerve is running along with, as you can see in this diagram, inferior thyroid artery. So see here, so that means if inferior thyroid artery will be injured, recurrent laryngeal nerve is injured, and we know that recurrent laryngeal nerve is giving innervation to all the intrinsic muscles of larynx and also mucosa, lower part of the mucosa, sensory innervation. So done with this, now let's move on to question number 41. Cavernous sinus receives blood from all of the following except, cavernous sinus receives blood from all of the following except superior inferior petrosal sinus, superior ophthalmic vein, sphenoparietal sinus, superficial middle cerebral vein. Question number 41. Cavernous sinus receives bloods from all except, 4 options are there. So let's move on to the correct answer. Actually, my dear aspirants, if we have to pick one correct answer here, so cavernous sinus receive bloods from all except, we will go with superior inferior petrosal sinus as the correct answer. The reason is that superior inferior petrosal sinus, why I am telling this as the correct answer, superior inferior petrosal sinus, because superior inferior petrosal sinus are draining channels and it is forming communication. These are actually draining channels of cavernous sinus and they are important for forming communications of cavernous sinus. Rest all, superior ophthalmic vein, sphenoparietal sinus and superficial middle cerebral veins are direct tributaries of cavernous sinus. These are direct tributaries of cavernous sinus. So we'll go with A as the correct answer. Got it everyone? So let's move on to question. So let's see this. So here what you can see in this diagram, you can clearly see the tributaries. You can clearly see the tributaries. So one tributary source of cavernous sinus is from the source of orbit. So if you want, I will enlarge this image. Okay, see here. So tributary source is from orbit, is from meninges. It is from the brain. 3 sources are there. The direct tributaries are is the central vein of the retina, superior ophthalmic vein, inferior ophthalmic vein. So 3 sources, 3 tributaries from the orbit are central vein of retina, superior and inferior ophthalmic vein. The 3 sources from the meninges will be sphenoparietal sinus and middle meningeal vein. The 2 sources we have got from the brain, and the 2 sources are superficial middle cerebral vein and inferior cerebral vein. So these are lying in direct communication with the cavernous sinus from the three sources: orbit, brain and meninges. Now, communication can occur via facial veins. So, we have got the communications which can occur via facial veins, can occur via pterygoid venous plexus also, and emissary vein passing through various foraminas, basilar venous plexus, and draining channels are there. So, the draining channels, this was in the option, and you can see here superior inferior petrosal sinuses are draining channels for the cavernous sinus, which will form again communication with that of transverse sinus and internal jugular vein. So, direct tributaries nahi hai, so we will have superior inferior petrosal sinus as the correct answer for question number 41. Now, okay, all of the following nuclei belong to general visceral efferent. What do you mean by efferent? Motor. So, which is the correct answer, which is not a nuclei of general visceral efferent component. General visceral efferent component is for parasympathetic innervation. Okay, I have taken one session on cranial nerve nuclei, functional component and cranial nerve nuclei. Those who have missed out, they can see this session. So, general visceral efferent. General visceral efferent is for parasympathetic innervation. They are for cranial outflow of parasympathetic innervation. So, actually in this category, nucleus of tractus solitarius is the correct answer, because nucleus of tractus solitarius is carrying afferents fibers. Okay. So, this is the correct answer. It is carrying, it is the nucleus for, it is the cranial nerve nuclei for afferents, okay, that is special visceral afferent and general visceral afferents. Not, it is carrying afferents fibers, not the general visceral afferent. Edinger Westphal lacrimatory dorsal nucleus of vagus along with superior and inferior salivary nucleus. So, these all superior, inferior salivary nucleus, these all are 5 nucleus of general visceral efferent, but nucleus of tractus solitarius is a common nucleus of special visceral afferent and general visceral afferent. So, this is common nucleus for special visceral afferent and general visceral afferent. Got it? So, we have got D as the correct answer. Let's move on to question number 42. Chagassi-neck tubercle is, what is Chagassi-neck tubercle? It's an point, it is a carotid tubercle of C6 cervical vertebra, or it is found on the first rib, it is found on the medial condyle of humerus. What is the correct answer? Question number 42, please mark the correct answer. Chagassi-neck tubercle is, which of the following is the correct answer? Okay, my dear aspirant, the correct answer is Chagassi-neck tubercle is a carotid tubercle on 6th cervical tubercle. Actually, it is in anterior transverse tubercle on 6th cervical vertebrae. So, see here. Here you can see here these are, okay, it is present on 6th cervical vertebrae. I will show you actually. You can see here in this diagram, you can clearly see the anterior tubercle of transverse process has been shown. The anterior tubercle of the transverse process has been shown for which all vertebrae, that is for C3, C4 and C5 and C6. And the 6th, the anterior tubercle of 6th cervical vertebrae is called as carotid tubercle, which is also called as Chagassi-neck tubercle. So, we have got this as the correct answer. One more specimen is there which is showing you the Chagassi-neck tubercle, and it is present in 6th cervical vertebrae. Transverse process. Question number 43. Where is the groove of subclavian artery located? Where is the groove of subclavian artery located? Posterior to scalene tubercle, on the clavicle, on the manubrium, or at the level of sternal angle? What is the correct answer? Question number 43. Where is the groove of subclavian artery located? Exact location of subclavian artery groove. The correct answer is A, posterior to scalene tubercle. So, okay, I got an answer posterior to scalene tubercle. So, let me show you. Actually, this is exactly showing you the scalene tubercle in this diagram. Okay, this is the scalene tubercle, and just close to it you can see the subclavian groove, where the subclavian vessels is located. So one more diagram will give you the other. Actually there are two grooves, there is subclavian vein groove and there is also subclavian artery groove in relation to anterior scalene muscle. So this is related with the rib, this is related with the scalene tubercle of the rib. Okay, let's move on to question number 44. Okay, which structure, actually gaps which is present in between the constrictor muscle is also very important for you to know. So you have to know the gaps and the structures traversing through it. So structures passing through the gap between superior constrictor and the skull. Options are tensor villi platini, ascending palatine artery, glossopharyngeal nerve and stylopharyngeus muscle. Question number 44. Structures passing through gap of superior constrictor and the skull. So according to you, which is the correct answer? Actually B is the correct answer. So actually this space which is lying superior to superior constrictor muscle, space of Morgagni, this space is having 4 structures traversing. So I would like to explain the gaps in lying between the constrictor muscle with the help of schematic diagram. So see here. Here this is superior constrictor muscle, then we have got middle constrictor muscle and then we have got inferior constrictor muscle. So 4 gaps are there. One of the gap is lying above superior constrictor muscle. So above superior constrictor muscle, that means between superior constrictor muscle and that of base of skull. So this point is base of skull. So 4 structures are passing. One is auditory tube. So we have got this is the auditory tube which is passing. The other is levator villi platini muscle. So we have got also the levator villi platini muscle. So these are 2 structures. This is 1, 2 and other than that we have got ascending palatine artery. We have got ascending palatine artery. This is the 3rd structures and the 4th structure is, one more structure is there, that is pharyngeal branch of palatine branch of ascending pharyngeal artery. The 4th structure is palatine branch of ascending pharyngeal artery. So all these 4 structures are passing through, above the superior constrictor muscle. Now the gap between the superior and inferior constrictor muscle, 2 structures. One is the stylopharyngeus muscle and the other is the nerve supply. So these two structures are passing in between the superior and middle constrictor, that is stylopharyngeus and glossopharyngeal nerve. And in between middle and inferior constrictor we have got 2 other structures passing, again 2 structures passing, that is internal laryngeal nerve and superior laryngeal vessel. Now the space which is lying below inferior constrictor muscle, which is also called as tracheoesophageal groove. This space is also called as tracheoesophageal groove, and through tracheoesophageal groove 2 structures passes, internal laryngeal vessels and recurrent laryngeal nerve. Internal laryngeal vessels and that of recurrent laryngeal nerve. Done? Okay. Let's move on to the next, that is question number 45. Facial nerve innervates all of the following muscle except. Facial nerve is giving innervation to all the muscles except procerus, corrugator superciliary, masseter muscle or depressor anguli oris. Which is the correct answer? Facial nerve innervates all of the following muscle except. This is easy one. Actually, the correct answer is masseter. Why? Can you tell me? Masseter is the muscle of mastication, chewing the food. Okay, mastication, and we know all the muscles of mastication is getting innervation from mandibular nerve. Okay, procerus, corrugator superciliary, depressor anguli. These are all muscles of facial expression. So all these muscles are getting innervation from facial nerve except the masseteric muscle, because masseteric muscle is the muscle of mastication, getting innervation from mandibular nerve. So we have got C as the correct answer. Now moving on to the next. Which nerve arises by 2 roots, okay, that surrounds the middle meningeal artery. So which is a nerve which is forming a loop around middle meningeal artery? Direct MCQ, whether the nerve is auriculotemporal nerve, whether the nerve is buccal nerve, whether the nerve is mental nerve, whether the nerve is zygomaticotemporal. So which nerve is it which is forming a loop around middle meningeal artery? Which nerve surrounds by two roots that surround middle? Actually, the correct answer is auriculotemporal nerve. Auriculotemporal nerve. See here. So, here in this diagram, you can see, if I enlarge this diagram, so you can clearly see the middle meningeal artery. This is the middle meningeal artery, no doubt. This one important. This is the nerve. This is the middle meningeal artery. Now, if you will see a very beautiful diagram showing a loop formed by a nerve, and this nerve is auriculotemporal nerve. So, auriculotemporal nerve is forming a loop around middle meningeal artery, which is seen in this diagram. Let's move on to the next question, number 46. Okay, this was also 46 and this is also 46. Okay, this is 46 part B, you can say. All of the following is supplied by ansa cervicalis. All of the following muscles is getting innervation from ansa cervicalis loop except. Yeah, auriculotemporal nerve was absolutely correct answer, Mr. King, absolutely correct. Now let's talk about the next one. Yes, now let's talk about the next one. That is question number 46. All are supplied by ansa cervicalis except thyroid, sternothyroid, sternohyoid, inferior belly of omohyoid. Thyroid is the correct answer. Okay, actually these are all the muscles, these all muscles are infrahyoid group. Of all infrahyoid group, only thyroid muscle is getting innervation from C1 fibers, which is also carrying the fibers of hypoglossal nerve. So see here. Yes, Mr. King, you are right. A is perfectly correct answer. Yes, yes dear, absolutely correct. So see here, if you will see this cadaveric image, you can very nicely see this loop. So see this loop. This loop which I am showing you, this is having SR and IR, that is superior and inferior root, and this loop is ansa cervicalis loop. This is ansa cervicalis loop. This is ansa cervicalis loop, and this is lying on the anterior wall of carotid sheath. So here also you can appreciate here you can appreciate the internal jugular vein. You can appreciate the internal jugular vein very nicely. You can appreciate the vagus nerve very nicely. You can appreciate common carotid artery very nicely. The carotid arteries very nicely. Actually, we know that the carotid arteries, the internal jugular vein, vagus nerve is the structures which is the structures of carotid sheath. So actually, ansa cervicalis loop is lying in the anterior wall of carotid sheath. It is lying in the anterior wall of carotid sheath. Okay, this is showing you the loop here. Now let's see here. Now we will see here. So actually, when we are talking about ansa cervicalis loop, it is having inferior root, it is having superior root. Okay, now this is the superior root and this is the inferior root. Inferior root is formed from C2 and C3 and superior root is formed from C1, and it is supplying both the bellies of omohyoid, sternohyoid and sternothyroid. You can see here thyroid, this is the muscle which is not getting innervation from ansa cervicalis, it is getting innervation directly from C1, which is also carrying the fibers of hypoglossal nerve. Got it? Now let's move on to question number 47. Superficial neck laceration is giving abnormal findings. So which of the following will be the presentation? Please see, read all the four options and give me the right answer. Agar neck laceration hota hai, if there is a case of neck laceration, which of the following will be the abnormal findings which will be found? Okay, it will lead to the paralysis of which of the following structure? So my dear aspirant, the correct answer is actually superficial neck laceration leads to the paralysis of spinal accessory nerve. It will lead to the involvement of spinal accessory nerve, and when spinal accessory nerve is involved, it will lead to paralysis of sternocleidomastoid muscle and that of trapezius muscle. It leads to the paralysis of two muscles, sternocleidomastoid and trapezius muscle. Now see here. Here you can see in this diagram, the spinal accessory nerve has been shown. This is the nerve. This is spinal accessory nerve, which is giving innervation to trapezius muscle and sternocleidomastoid muscle, which is lying in the posterior triangle of neck, traversing between the roof and the floor. So see here, if we talk about spinal portion of the of this 11th nerve, it is giving innervation to sternocleidomastoid and trapezius muscle. Yes, yes, Mr. King, it is because paralysis will happen if these two muscles are getting innervation from spinal accessory nerve. So, in this case, if there is injury to the neck, these two muscles will be paralyzed. Yes, yes, Mr. King, yes, Mr. King. Yes, definitely. Let's move on to the next. Maxillary division. So, it's a very direct MCQ. Maxillary division is passing through which foramen? Maxillary division is passing through which foramen? Foramen rotundum, ovale, superioorbital fissure, foramen spinosum. Maxillary division of trigeminal nerve is passing through which of the following foramen? Which is the correct answer, dear? Mr. King is telling B, foramen ovale. Absolute, no. It's from foramen rotundum, dear. Correct answer is foramen rotundum. So, actually maxillary, two structures passes through rotundum, that is maxillary nerve and emissary vein. Maxillary nerve and emissary vein. Maxillary nerve and emissary vein. Through foramen ovale, we have got four structures passing, that is MALE, male. What is it? M for mandibular nerve, A for accessory middle meningeal artery, L for lesser petrosal nerve, E for emissary. Superior orbital fissure से third cranial nerve, fourth cranial nerve, sixth cranial nerve, superior ophthalmic vein, abducer nerve, nasociliary. Foramen spinosum से middle meningeal artery and nervus spinosum passes. Okay. So, see this diagram here, you can see actually we have got three divisions of trigeminal nerve. If we talk about ophthalmic division of trigeminal nerve, it is passing through superior orbital fissure. If we talk about foramen rotundum, the maxillary nerve is passing, as you can see, maxillary nerve. If we talk about foramen ovale, which nerve is passing? Mandibular nerve. So, this diagram is clearly showing that three division of the trigeminal nerve. Ophthalmic will pass through superior orbital fissure, maxillary through foramen rotundum, mandibular nerve through foramen ovale. Indicator of start of gastrulation process in the embryology part, in the formation of three germ layers, is by the presence of which of the following embryological structure? Neural groove, neural pit, primitive streak, formation of notochord. Indicator of start of gastrulation is by the formation of which of the following structure? Primitive streak, formation of notochord, neural pit or neural groove. So, mark the correct answer. The correct answer here is, question number 49 will be primitive streak. Actually, when you see the bilamellar germ disc and the primitive streak start following, it will lead to the formation of third layer, that is gastrulation. So, when you see the dorsal aspect, as in here you can see the formation of primitive streak has been started, that means the process of gastrulation has been started. This start with the third week of intrauterine life. Yes, absolutely right. Dabriation, absolutely correct. Yes, correct. Yes, dear, it is correct. Okay, we will now question number 58. This is the last MCQ of today's session. Before, okay, thymus develops from, I will also give you the details of upcoming session. Thymus develops from first, second, third or fourth pharyngeal pouch. Direct MCQ. Thymus develops from first, second, third or fourth pharyngeal pouch. Which is the correct answer? Question number 58. Okay, what is the correct answer? Please mark the correct answer. So, actually the correct answer is third pharyngeal pouch. Third pharyngeal pouch. Okay, so it's the third pharyngeal pouch. See here. Now, my dear aspirants, what you can see? If we talk about the first pharyngeal pouch, see here, if we talk about the first pharyngeal pouch, so here we have got on one side pharyngeal pouches and here pharyngeal cleft on the outer aspect. So first cleft is forming external auditory meatus, but first pouch is forming middle ear cavity and auditory tube. The second pouch is forming palatine tube, and the third pouch is forming inferior parathyroid gland and that of thymus. So palatine tonsil by second, and parathyroid gland inferior, and thymus by the third pouch, and superior parathyroid gland also leads to the formation of ultimo branchial body, that is the fourth pouch. First pouch is forming auditory tube and that of primitive tympanic cavity. So actually this diagram will help you to understand all the structures formed from these pouches, and also cleft is forming external auditory meatus, which is shown on other side. So my dear aspirants, before ending the session, I want you to tell that tomorrow I am taking high yield anatomy MCQs for NEET PG 22 examination. My dear aspirants, do come on the platform so that we will have the discussion of important MCQs. Sunday, tomorrow is Sunday, and I will take afternoon 2 sessions of 45 minutes each. So you can download the Unacademy app and you can use the code NAT10 to be present live for the session. This will be absolutely beneficial for you. Download Unacademy app and present live for tomorrow's session, because this session is not on YouTube. This session is on Unacademy app. Tomorrow there is a test also, free test for FMG aspirants, 2022 examination, and NAT10 is the code to get enrolled for FMG grand test tomorrow on 30th January. 9 AM is the timing. So get enrolled by using the code NAT10. Also, I would like to show you the pricing detail of Unacademy Plus and Iconic. You can use my code NAT10 to enroll and get additional 10% discount. All the best. Keep studying. We will again meet with the upcoming session. Thank you. Do like, subscribe and share the channel. Let's Crack NEET PG channel. And you can use my code for unlocking the free session and also for taking the subscription. If you are attending the session on the Unacademy platform, you will also be able to get the PDF notes. All the best. Keep studying. Thank you so much. Okay, all the best students, all the best. So I am just ending the session. All the best. All the best, dear. Thank you. All the best. So let me just end the session now.